Meeting. Council members are attending this meeting remotely by video conference. Tonight's meeting is available to the public on Channel 8 and through live streaming on Brookfield's website. Public participation is encouraged by calling 855-695-3744 and pressing *3 to be placed in the queue for comment. Please note, if you would like to speak on more than one item on tonight's agenda, you will need to press *3 each time to be placed back in the queue for comment. Public comment will be limited to 90 minutes total per item. The first 1 to 15 participants in the queue will have 3 minutes to speak. The next 16 to 25 in the queue have 2 minutes to speak. If time remains, the next 26 plus participants in the queue have 1.5 minutes to speak. Again, the number is 855-695-3744. And don't forget to press *3 to be placed in the queue. Screeners will ask callers for their first and last name, neighborhood, and the agenda item the caller would like to comment on. Please call several minutes before the agenda item and press *3 to ensure you are in the queue for comment. Public comments will also be taken during the public comments section for topics that are not on our agenda tonight, using the process previously outlined. Again, the number is 855-695-3744 and press *3 to be placed in the queue. The City Council meeting is called to order. Will the clerk please call the roll?
Anderson. Anderson. Castriata.
Here.
Broom.
Here.
Hinkle.
Here.
Jezierski. Jezierski. Law Evans.
Here.
Lim.
Here.
Lindstedt.
Here.
Schaff.
Here.
Tessier.
Here.
A quorum is present. Will everyone please rise and join me in the Pledge of Allegiance? I pledge allegiance to the flag of the United States of America and to the republic for which it stands, one nation, under God, indivisible, with liberty and justice for all. And I'm looking forward to both Boy Scouts and Girl Scouts doing that. In an effort to keep order for tonight's meeting, I ask council to please utilize the video conferencing tools to raise their hand for comment on when making a motion or a second. I will call on the first hand raised to state the motion and the second hand raised to make the second as appropriate. I ask council members to limit their comments to 5 minutes. Abby will be assisting me with the timekeeping and will provide council members with a notification via video conferencing chat when 1 minute remains. Please ensure you are on mute when not speaking. If a council member needs to leave the meeting, please inform me before doing so. And we do plan to have a 10-minute break at approximately 8 p.m. We will begin with council's review and approval of the agenda, this evening's agenda. Council may add or remove items from the agenda, or council may revise the order of business for the meeting. I'm going to request that we move items 11E, Resolution 2021-38 regarding Judge Davis's appointment as a deputy municipal judge to petitions and communications because it ties in with another matter. Are there any objections to that? Noting no objection, I'll say, does any member of council have any additional comments or questions regarding this evening's agenda? And I will call on Councilmember Schaaf.
Thank you, Mayor, and thanks for combining the two items, 11E with item, I believe it's 4A. Yes, 4A. I would like to ask council's consideration to move item 11D to the consent agenda, item 11D.
I will ask if there's any objections. If so, raise your hand. Noting none, we will move 11D to the consent agenda. So we'll move on to petitions and communications. This evening I have a proclamation, and is it written out here for me? I have a proclamation declaring that March 23rd, 2021 as Judge Davis Day, who is retiring as Broomfield's presiding municipal judge. Judge Davis is on the call this evening. Welcome, Judge Davis. Additionally, item 11E is a resolution appointing Judge Davis as a deputy municipal judge, and therefore we will review the items concurrently as previously mentioned. Following my reading of the proclamation, we will ask for public comments on both the proclamation and the proposed resolution. But let me first, I'll make a note that that when I was mayor before, I was on a council that selected Judge Davis many years ago. So it's with with sadness that I see him retire, but I understand he likes to travel, and that's something I plan on doing next year. So let me read my proclamation. Whereas Judge Randall J. Davis began serving the community as a municipal judge, court judge on July 14, 2011, and Judge Davis is retiring from the position of presiding municipal judge. He will stay on as a deputy judge. He has provided all individuals timely, convenient judicial administration services in a courteous, dignified, and respectful manner, and he has overseen over 55,837 traffic and ordinance violations, and he has attended 66 consecutive Dakota Municipal Judge Association conferences, and whereas he pitched for the city and county city council softball team on numerous occasions, leading them perhaps not to victory, but to fun and camaraderie, and whereas he has visited approximately 88 countries, always loyally returning to his home in Broomfield, and whereas in his over 9-year tenure, he has faithfully and honorably served the residents of Broomfield. Now, therefore, I, Pat Quinn, Mayor of the City and County of Broomfield, do hereby declare and proclaim March 23rd, 2021 as Judge Davis Day. So in March 23rd, is my understanding, it's going to be Judge Davis's last day, which is why we've named that his day. So we're going to go ahead and go to public comments and ask if any member of the public, do they want to comment on either the proclamation or Judge Davis, and the resolution to name him as the deputy is so. We'll need your first and last name in your neighborhood, but I'm not seeing anybody on the queue. And so we will move to city council members. Is there anybody from city council like comment tonight on Judge Davis? Mayor Pro Tem.
Thank you, Mayor, and thank you for your many years of service, Judge Davis. It's been a pleasure playing softball with you on July 4th, and I'm glad to know that you're still going to be part of the family as our deputy judge. So it's mixed feelings. I know you're ready to go resume your travels, and we're so happy for you, but I'm glad we'll still be able to see you around from time to time, and hopefully you'll be able to still pick up that game with us. Thank you.
Councilmember Schaaf.
Thank you, Mayor. Judge Davis, it's great to see you. It's been quite a while since I've gotten to come and see you in your courtroom. I can say that not one of those traffic violations was one of mine. So I have been there as a visitor and not as an attendee. So it's great to see you. Thank you for your many years of service. You have served Broomfield well, and I look forward to you as one of our deputy judges for Broomfield. Thank you.
Councilmember Groom.
Yes, so I am very pleased to have been touched by you for the last 3.5, almost 4 years of my council career. And I have to say, of everything that we do here, I can say that your leadership over the courts has brought a stability to Broomfield and a positive effect to our community with almost zero complaints. Well, I've never received a complaint from the courts in any of the thousands of emails I've received. So I thank you very much for that. Well, and happy travels to you. Thank you.
And, Judge, I'll just thank you again for your service. Once again, having known you now for 10 years, I've enjoyed the association. You came into the judgeship in a little bit unusual circumstances, and council, then and now are just pleased with the professionalism you brought, and how you've been a judge that we're all proud of, to say the least. And so I do want to ask you, Judge, where's the first place you're going to go travel?
I wish I had an answer for that question, Mayor. The whole world is closed down at this point in time, and we were just watching the news tonight, lamenting the fact that Europe is in worse shape today than they were yesterday, apparently. So we were hoping to go to Europe immediately, but immediately sometime this summer, but I'm afraid that that may not come to pass. So we're waiting with bated breath to see what country will welcome Americans, and we'll be one of the first to sign up to go at that point. We both have had our vaccine shots now, so we're ready to roll or fly, as the case may be, as soon as somebody will have us. Thank you, Mayor, and the entire council. I'm actually a little stunned by the Randy Davis Day, Judge Randy Davis Day, and I'm greatly honored by that. It's been my honor to be your honor now for the last 10-year period of time. And as you all know, that this is my most recent judge job, and I date back now over 33 and a half years of being a judge, and I've loved every minute of it. And as I've said before, being your presiding judge has truly been the capstone of my lengthy career at this point in time. As you've been saying all these kind things about me, I've been reminiscing and remembering all the fine times I've had in Broomfield in particular, and the bench in general. As many of you know, and has been referenced to, I was your first county court judge here in Broomfield's first state court judge. So I was in the building on November 15th of 2001 when we opened up as the first judge in the building at that time. I see my old friend, or my older friend, Jennifer Hoffman, on this call as well, and she was there with me on that day one event. She was our director of court services at this time. So I have a 20-year history now on the bench in Broomfield, and more specifically 10 as your presiding judge. Thank you for this opportunity to have served. I arguably could have retired many years ago, but I've not done so because I've enjoyed the job so much. I've enjoyed working with this council and all the prior councils. It's been truly a pleasure and an honor to be able to serve the citizens of this great community in this capacity. I can't believe that somebody, my court administrator or somebody, actually sat down and counted up the number of cases that we've seen in the last 10-year period of time. That was quite an accomplishment in and of itself to have done that. I enjoyed every one of those cases. Those cases are important to the people that appear in court, and therefore those cases are important to me. And I hope I've been able to convey that interest and that attention to each of those cases. I know that I'm in a section of the meeting that typically is limited to 5 minutes, and so I'll try not to exceed that. My Jan tells me I talk too much and my speeches are too long, so I'll try and make an exception to make this shorter and quicker tonight. Thank you again for the opportunity to serve. I had the pleasure of working with your new Judge Bachman today. She and I are overlapping today during a training session and introduction for her. I'm very excited, as you should be. She's going to bring a lot of enthusiasm to the job, a lot of new and creative ideas. You've made a wonderful selection, and she will be a great judge for you in the future. Again, thank you for all that you've done for me, including the designation of next Tuesday as Judge Randy Davis Day. That comes as still quite a surprise to me. So thank you for that great honor. I'll always cherish that as one of my most fond memories of working with you here in Broomfield. So thank you again for all that you've done. Maybe in my capacity as part-time judge or deputy judge, or maybe even let me come back and play on the softball team again in the future. I'll indicate to you that Morgie Morgenstern has also talked to me as well, the captain of
For the
the
seniors?
super seniors, since now at age 71, I'm eligible for his team as well. So I'm open to offers at this point in time. I'm a free agent. And so this appointment, if it passes tonight, making me a deputy judge may be the final thing that keeps me on your team in the future then. So again, thank you for everything. Thank you. Thank you. Thank you.
Yeah, this council is becoming quite fond of amendments, so they might put an amendment in there requiring that. So, so hey, I asked for community comments. I asked, for council comments. I did not have a chance. I didn't ask for staff comments. And Jennifer, do you want to say a word?
I can remember the first time that I met Judge Davis. He was going for the county court judge, and I remember the day. It was my birthday. It was September 19th, and I had just had my son, and Randy and I went and met for coffee at this little tiny coffee place that was over on Nickel Street. And I can remember asking him, because none of us had a good sense really of what a combined court. So I structured this whole combined court not having any concept of what the county court did, what the district court did, had a little sense what the muni court did. And so to have Randy on my journey when he was appointed, being able to run up after we date stamped some kind of filing that we didn't have any idea what to do exactly with that filing. So we really did start from square one, my friend. And I wish you nothing but the best. You have left Broomfield better than you found it.
Yep.
Thank you.
So we'll move on then to proposed resolution 2021-38. And will the clerk please read proposed resolution number 2021-38 by title?
Resolution number 2021-38, appointing Randall J. Davis as Deputy Municipal Judge.
Is there a motion? Mayor Pro Tem.
Thank you, Mayor. I move that resolution number 2021-38 be adopted.
Councilmember Groom.
Second.
Is there any discussion? Will the clerk please call the roll?
Anderson,
Yes.
Castriata,
Yes.
Broom,
I should amend that and make sure that we could make him be on the baseball team on the Broomfield side. But yes, that's a yes.
Hinkle,
Yes.
Law Evans,
Yes.
Flynn,
Yes.
Lindstedt,
Yes.
Schaff,
Yes.
Tessier.
Yes.
It passed unanimously. We've got two judges on the line here. There's some type of implied contract in there somewhere. We'll need to give you consideration or something, but we look forward to see you on July 4th. Well, I mean, I don't know, Jennifer, we would like to have a softball game on July 4th, but we have not made that decision. But, God willing, and the creek don't rise, we'll have a softball game on July 4th or shortly thereafter. So anyway, Judge Davis, enjoy your travels. Unfortunately, it was kind of a silly question to ask where you go first, but you certainly have an idea, but it does depend upon what's open. So enjoy your retirement, but we're going to get to see you. We just assured that by that vote. So anyway, we'll move on to public comments. So thank you, Judge. Let's go to public comment. This is an opportunity for the public to comment on matters other than the items already listed on this evening's agenda. To be placed in the queue for comment, please call 855-695-3744 and press *3 to be placed in the queue. Public comments will be limited to 3 minutes. I'm not noting anybody in the queue. The Mayor Pro Tem shaking her head no, so there's nobody in the screener view. So we'll go to Council's community and event updates, which are next. Does any member of the council have an update this evening? Noting none, I'll just make reference to the fact that last year at this time, as I mentioned last week, I was in DC. We're doing our US 36 Northwest Mayors and Commissioners Coalition. We're doing our lobbying trip today, Thursday, and Friday. By Zoom. It's not quite the same experience, but had really good conversations today with both Senator Bennett and Senator Hickenlooper. And it's just nice to see people that that are serving us proud. So that's my community update. Anybody else? Council's consideration of the consent agenda is next. Following the clerk's reading of proposed consent agenda items 7A through 7C and 11D, we will ask for public comments. Will the clerk please read agenda items 7A, 7B, 7C, and 11D by title?
7A, approval of minutes, regular meeting of March 9th, 2021. 7B, resolution number 2021-54, authorizing and approving the purchase of a tandem axle truck. 7C, resolution number 2021-58, adopting the second amendment to the City and County of Broomfield budget for the year 2021. And 11D, resolution number 2021-22, authorizing and approving an agreement by and between the City and County of Broomfield and Farmers Reservoir and Irrigation Company for canal maintenance and license.
We will now proceed with public comments. If there's anything for the public, and I'm not seeing anybody, in the queue or in the screener view, I think, and so we'll go ahead and move on to council members. Does any member of council have a comment on these agenda items? Councilmember Groom.
Sure, I just had a question regarding, oh goodness, sorry. Let me get the number. 7C on the budget. If Mrs. Ritchie is available. And I just wanted to know is, do we have a separate account system for all of our puts and takes on the COVID side of the house? Or how is that intermingled? How do we see that?
Thank you, Councilmember Groom, and good evening, Mayor, members of Council, Brenda Ritchie, Chief Financial Officer. So in terms of the specific grant funding, we track that as we do with all of our grants with a special project code, and it goes in the appropriate budget line item or chart of accounts, if you will, designated for that revenue and expenditure. So it's further segregated with a designated specific grant code, if you will, to identify those specific fundings.
Okay, so the revenue comes in with a specific coding as we get those additional funds, and then it's also coded separately as we expend them. Perfect. That's correct, and there will be instances where it goes into the general fund. So if it's a reimbursement, it would go back into the general fund of where the expense initially incurred. That's correct. So it all goes into the general fund, but you could track it. If we said give us the exact amounts, you could track it. Thank you very much. I appreciate it.
Any other questions?
That's all I had. Thank you.
Any other questions or comments from City Council? Is there a motion that the recommendations contained in the staff reports for agenda items 7A, 7B, 7C, and 11D be approved? Councilmember Groom? Councilmember Groom?
I said it, I just didn't, it wasn't off mute. So moved.
Mayor Pro Tem?
Second.
Is there any discussion? Will the clerk please call the roll?
Start again.
Castriata,
Yes.
Groom,
Yes.
Hinkle,
Yes.
Law Evans,
Yes.
Lim,
Yes.
Lindstedt,
Yes.
Schaff,
Yes.
Tessier.
Yes.
It passes,
And I was not called, so add yes for Anderson.
Oh,
yeah,
I
was gonna
apologize.
Thank you.
Anderson.
say- and so we'll note that Anderson's joined the meeting and so that means it passes unanimously. So we'll go on. There is no business before the Board of Social Services this evening. This evening, we have a COVID-19 update for the Board of Health's review. The meeting of the Board of Health is called to order. I'll ask the clerk to please call the roll.
Anderson,
Here.
Castriota,
Here.
Groom,
Here.
Hinkle,
Here.
Dupersky, Law Evans,
Here.
Lim,
Here.
Lindstedt,
Here.
Schaff,
Here.
Tessier.
Here.
A quorum is present. The board members have a copy of the agenda memorandum, which I'll ask our staff to summarize.
Thank you, Mayor and Council. Good evening. Jason Volling, Director of Public Health, will walk us through this next item. We didn't have a COVID update with Council yesterday, so Jason may go into a little bit more detail, as it won't necessarily be an overview, but starting fresh. Jason?
Yeah, thanks, Ms. Hoffman, and good evening, board members. As noted, Broomfield continues to remain in level yellow according to the state dial. One thing that we've been noticing is our case incidents and our percent positivity have been increasing, and you can see those numbers below. However, our hospitalizations have stayed stable, which is extremely good news, and no new deaths over the last week, which is always critical. We have seen that we've had 4 outbreaks. Some of these we've shared before, that we have 2 high school sports teams, 1 volleyball club, and 1 child care center. And then some more good news to report is while the state is seeing increases in the new variant cases, there are no new variant cases in Broomfield since our last report. So we'll continue to follow that. A couple other key highlights is our vaccine eligibility has expanded, or will expand, I should say, to phase 1B4 on March 19th. The governor that had previously announced that was March 21st, and that includes a pretty comprehensive list. It's our 50 plus, our grocery workers, some of our essential services, et cetera, et cetera. I won't go through the full list. So we're scaling up and preparing for that. You can see that we're still making significant progress on vaccinating our older adult populations. So 87% of our 70 plus population, 84% of 65 to 69, and 51% of 60 to 64-year-old residents have either initiated or completed their vaccination. And the reason we changed this from first dose to second dose is now with the J&J Janssen vaccine. That's just a 1-dose vaccine, so some people can complete it just through 1 dose. We're continuing to talk to the state and local partners about transitioning both locally to larger scale events, and at the state level, them launching the 6 massive large-scale events that they have planned. And so that the idea behind that is we have our existing systems, but to try and get as many people through as possible, as we call it throughput in public health, you want to vaccinate as many people as safely and quickly as possible. I shared last week we're in conversations with the First Bank Center and with CDPHE. And if we receive the J&J vaccine from CDPHE, and they've indicated that potentially could come through in early April, that will give us the ability to stand up the First Bank Center. And then we've again have a very successful partnership with Thornton Fire, who has been vaccinating our Broomfield residents, and encourage again all of our residents to either sign up on our vaccine interest form or go specifically to the our vaccine website, and you can register through the Thornton Fire appointment system. And then the last thing I want to mention is that the state health department has engaged in a stakeholder process discussing two things. One is the Dial 3.0 and what that potentially looks like going forward. And then a second discussion of what does that potentially look like to devolve the statewide orders and the dial to local public health agencies. And so they've met with the public health directors across the state. They met with CCI, CCAT, and CML through that stakeholder process. I would say a couple of key themes that I heard that aligned with some of our public health recommendations was it would be nice to keep the statewide mask order in place as long as we can. Our goal ultimately is to get through the end of the school season and at the same time keep vaccinating as many of our residents that we can. The second thing is being very wary of not doing anything leading up to spring break because we know we have a lot of out-of-state visitors coming in that no longer have these types of public health orders, and specifically in the ski resort communities, which then can contribute to a larger spread in those communities. And I would say the last thing is really just being thoughtful about at what point do we achieve, through vaccinations and through just immunity, where we're not going to see dramatic hospitalizations and deaths anymore. And the School of Public Health has done some modeling on that. The one unknown with this is the variants and how they could potentially impact all of the progress we're making. So that's just one thing that we'll have to keep an eye out on. And with that, I believe it concludes my presentation, and I'm happy to answer any questions you may have.
Thank you, Jason. We'll now proceed with public comments. If there's anyone who'd like to be heard, please press *3, state your first and last name and neighborhood for the record. And once again, I'm not noting anybody in the queue or anybody attempting to go in. So we'll go to council, or questions from the board are next. Does any member of the board have any questions? Council, Board Member Lim.
Yes, thank you. I was glad to see that Jason shared with us that the Association of Local Public Health Officials had also supported that mask mandate continuation by the state through the end of the school year. My question is about the increase in the positivity rate and the incidence rate. Obviously, with the older population, the huge percentage of vaccinations, we can feel fairly confident that we won't have a great increase in the hospitalizations or deaths, but it is concerning, I guess, to me still, that the positivity rate is creeping up to 5 again. So do you have any idea with contact tracing or demographics to say what's going on there?
Yeah, so there's two answers to your question, Councilmember Lim, and it's a very good question. One is obviously as you begin to open up sectors, and also we're seeing more that's happening within outside of school settings, as we were mentioning, some of those epi trends we're seeing as far as cases that are being contracted. You expect cases to go up. The percent positivity, again, is a little bit more concerning because once we exceed that 5% positivity, it illustrates there's more spread happening in our community. I think the answer to your second question is the critical one, is we are vaccinating our older adult populations, but not all of those populations have received their full doses of vaccines. And then it takes 2 weeks after that to build up your full immunity. So I think we're still a little bit ways out to see the ultimate impact of what we're doing as far as through vaccinations. But the good news is what we're already starting to see is some declines in cases in those age groups. And so we're seeing cases more rise in our, I think it was, I want to give you the number, 10 to 19-year-olds that are making up more of our cases. And so just, again, being aware where that transmission could be occurring. We're hearing, again, a lot of it's not happening specifically within the school setting. So what's happening outside of that school setting? And then the last thing I'll say is, yes, we can decrease hospitalizations and deaths, but if we still have not reached herd immunity, that is a bunch of people that still could contract COVID. And we see that then for the potential for variants to continue to spread or even to mutate further and have new strains. So we just want to be very thoughtful and cautious about that as well.
Okay, thank you for that answer.
Councilmember Schaaf.
Thank you. So, I appreciate board member Lim's questions regarding the cases and positivity. As we see that continue to go up, it is concerning that 10 to 19-year-olds are making up that bigger chunk. And part of my concern comes is that we're headed into spring break. BVSD has spring break starting this next week. And while CU does not have a spring break, they did have a snow day yesterday, but they do not have spring break. There is still concern as we go into the spring break season. So, as we heard before the Thanksgiving holiday, we heard before the winter holiday season, the recommendation from public health officials in our state were stay at home. What is the public health advice recommendation for spring break for those that are headed into spring break plans or potential travel during spring break?
Yeah, obviously we're going to continue to follow what the current public health guidance says as far as where we're at with capacity limits, but we're going to be doing more targeted and direct outreach to parents. And we just discussed this today as a public health team as far as both parents and teens, what are the best practices that you could take to protect yourselves over spring break. So obviously you don't want to be getting together with a significant number of friends indoors without wearing masks. We go back to the basics when it comes down to this, or having large parties, celebrations, whatever it may be, as you start to talk about the college population that can increase that spread. So the things we know and that we'll continue to communicate to parents and to teenagers is we really need your help because we're down to the finish line. If we can make it through spring break and follow those public health precautions we have in place, I think we're going to be in a much better position versus if they are not followed and we see a rise in cases.
Yeah, and I appreciate that, and especially the targeted messaging there. You made the analogy, we're almost to the finish line, and I heard a good one the other day that, we've traveled a year on this road, And at this point, we're on that off ramp, and all we got to do is get off off this road. But right now we are on the off ramp, and at this point we can't afford to just derail this. I guess I mixed metaphors there, or at least mixed transportation systems. The last one that I have, is concerning the governor's statewide mask order, which, you had commented that, we want to keep this as long as we can. And I think the piece behind that is there's actual metrics and kind of that ability to say, we are so close and we know that masks have been so effective. What are those metrics that we're looking at in order to basically say we are in the clear, on this? What are we looking for in terms of herd immunity, vaccination rates? What are we looking for at that point to say we are off that off ramp and we are going down, whichever road now?
Yeah. Thank you, Councilmember Schaaf. And I can tell you there's not agreed upon definition of those metrics at this point in time. And even with my public health colleagues, there's some debate that's still occurring. And I'll say the things that are playing into this as we think about it is obviously from a public health perspective, we would like to keep as many of our public health measures in place, and it may be through recommendations or it may be through public health orders to ultimately reduce community transmission to a point that it's down to endemic levels, which means it's within the population, but you're not seeing that broad community spread. I don't think we're at a point where we can plan on eradicating the disease at this point in time, but hopefully in the future we get there. The other part of that, though, that I think plays into it is if we truly can get to herd immunity with the vast majority of our population, 70 to 80%, that starts to get to the place of looking at what are some of those areas where we can relax some of these guidance and restrictions. And you see the CDC is already starting to work on some of that guidance. If you have two vaccinated households, the ability to get together without masks and situations like that. And I expect more and more of that guidance to keep coming out in the future, both from the CDC and from the governor's office and the state health department in defining what that looks like. And then the last thing that plays into it is COVID fatigue. I think we're at a place that we've been doing this for a year. We've had public health orders in place. And once you start to get to a place where you see hospitalizations and deaths going down, and we're seeing this in some other counties, is there's still that public will to continue to follow those public health orders or even continue to follow the public health guidance. And so we just want to be very thoughtful around that too, is how can we not only through orders, but just through guidance continue to have our residents make the best decisions.
Thank you, Director Valling. And as the mayor mentioned, it was just a year ago that he and I were in Washington, D.C. for the Northwest Mayors and Commissioners. And I mean, since that point to now, we've learned so much. The road, the end of the road is right there. And so I think that, as we look to that, those mitigation strategies that have worked all of this long to, keep the virus transmission lower than that critical point, I think, if we can just continue to do that, I think that we can really get to that, end sooner than if we just kind of break all those metrics or measurements early. So thank you for that insistence. I appreciate it.
Board Member Henkel.
Thank you, Mayor. And I love Councilmember Schaaf's metaphors. Of course, it's transportation. And so that really made me kind of giggle. He also stole my question. My question was about herd immunity. Like, what are those metrics? Like, where's our last mile station, right? So went back to transportation there, Devin. But I really think it's important, and I think somebody mentioned this in the CCAT call yesterday about how we need to have education about vaccines. I'm hearing that a certain percentage of men on a certain political leaning side are not getting vaccinated. So I really want us to really work on possibly even local language that we can use to show the value of vaccinations. And that opens up our businesses, right? So I feel like we really need to hone in on that. And then, you know, I worry about a little bit about, and I've talked this about you, or not about you, but with you, Jason, just about our transmission levels still can be high, you know, even amongst our kids, because the variants are known to just pass quicker with our kids, but they're not more hurtful or harmful. And so I worry about all this weight being on transmission. And I'm just wondering about the dial on if that transmission is actually equating to, you know, needing more help or more health care. So, you know, I don't know if we can speak to that, or if you see a change in that with the variants and then higher vaccines. I don't know what your thoughts are on that a little bit.
Yeah, so I think the other part of this is we also know that vaccines haven't been approved for our children yet, and they're just announced today they're going to start with the clinical trials, which is great news. At the same time, when we're thinking about spread within that specific population, I think there's two things that we just want to be very thoughtful about. And one is really being mindful of the potential either intermediate or long-term symptoms that are associated with COVID-19. So again, this is a novel virus where we're still doing a lot of research. And so that's one thing we're asking, can we continue to have more information? Yeah, they may not end up in the hospital, but do we see some of those long-lasting effects that occur? And I need to specifically look within the adolescent and children population to see what occurs there, council member or board member Hinkle. But I do think that if we can get to a point of reducing community transmission, having herd immunity more broadly in our adult population, what we're seeing within the specific school settings is less of that community transmission with our adolescents and our children.
Okay, thank you. And then do we have any plans on any verbiage for increasing just awareness for vaccines and sort of its value for our businesses? Have we made that connection? Because I already made that connection in my head, but I just don't think enough people are making that connection in general. I don't know what your thoughts are on that.
Yeah, I saw the same article you're referring to, and we talked a little bit as a communications team around that. You know, with vaccine hesitancy, it comes from multiple places. In certain communities, it's due to lack of trust of the vaccine. There's the politicization of the vaccine. There's also questions around the accessibility of getting the vaccine in some of our populations that have had a significant systemic discrimination issues when it's come to medical care for those populations. Specifically with the group you're referring to, I do think it's really important that we tie it back to, if we all can get our vaccine, we are on that track to open up our businesses faster. So we've talked about building that into our communication messages.
Okay, thank you.
Board Member Tessier.
Thank you. And thank you for this presentation. Jason, I have just a couple of questions. The first is, what category for the vaccines are those that are 16 and over? Are they even in a category? Because they seem to be the ones that are getting the virus more readily, it seems.
Yeah, so they're going to be in the phase 2.
Okay.
category, which is when we open it up to pretty much the entire population.
Okay, and I didn't know if any of the schools or if you're reaching out with any of the high schools to maybe be a testing site, or I don't know how that would look, because I know that the Broomfield High School is currently doing the COVID testing through the simple like spit test, but just didn't know if there was interest or communication happening on that front.
Yeah, I could tell you, working with the schools as far as testing, there is, the state has sufficient testing capacity, especially for the school districts. And so they've really been thinking of ways to get those in the district's hands so they could test not only teachers, but students. And I mean, ultimately, where we want to get to a place with testing, if we were truly controlling this, is more not just identifying those individuals that come down with symptoms, but having more of that surveillance testing where we could test and identify those asymptomatic individuals as well. And so they're finding that testing twice a week in these situations is sufficient enough to be able to identify them.
Cool. And then a broader question is, well, not even a question, well, it's a comment that leads to more dialogue, maybe. Hoping that you could talk a little bit about what's going on with like the normal flu and other sicknesses that, public health typically sees, and, with mask wearing. Can you talk a little bit about that?
Yeah. So without having the specific numbers in front of me, I could just tell you there's been a dramatic decrease in flu cases and also flu hospitalizations. And it makes perfect sense because we're practicing these disease control measures. And so if it works for COVID, it's a same thing that we're protecting ourselves against the flu. And I fully anticipate when we come out of this that you still might see residents that decide, I want to continue to protect my health from a prevention point of view. And masks may become more acceptable for certain individuals, and more power to them because they'll be less exposed to other viruses. And that's one thing we've always known, is that if, other than masks, if you could just wash your hands and make sure you're very aware of, coughing, if you're around people that are coughing or so forth, you wanted that social distancing. I think the message has got out broadly that the community understands how viruses spread down.
Yeah, I think it's great. And I was talking with my husband over the weekend, just like, yeah, we'll probably see more people wearing masks, and hopefully it seems to me that Broomfield has done a stellar job at supporting that mask. And I don't think anyone will, hopefully not, stigmatize or create any shame or blame around those that want to continue wearing masks. Plus, there are so many cool designs on the masks. Like you gotta wear them, right? So I really appreciate all that you've done with this. You and your team have worked really, really hard, and we're so grateful. And I like the metaphor of being on the off ramp. So yes, let's stay the course, right, and land safely. All right, cool. Thank you so much.
Board Member Groom.
Thank you. Jason, I know you put some emphasis in your presentation associated with talking at the state level regarding the continuation of masks. Along with that, did they talk about distancing? I mean, because distancing, washing hands, and masks, we've all been told are all wrapped up in one. Is the state no longer looking at distancing as an issue or as a level of importance, just wearing masks? What was this discussions around the distancing?
Good question, Councilmember Groom. Obviously still recommending the 6 foot of social distancing is important, along with washing hands, but mainly from the public health perspective, when we're talking about this, the one thing that we know from the data and science that we're seeing is the masks are one of the most effective interventions we've had through this virus and through the last year. And the reason for that is just due to asymptomatic spread. So by wearing a mask, you may not be exhibiting if you weren't wearing a mask, you may not be exhibiting symptoms, but still have the ability to pass the virus on to others, either within that 6 feet of social distancing, or if you're in a specific situation through airborne transmission. So that's why we really wanted to emphasize that in our letter.
So if the state keeps the mask mandate, will they also keep the distancing, or will they lift that?
I'm not sure yet on the answer to that question. I think that we'll have to wait and see with the update to the dial they're proposing what stays in and what doesn't. And again, the idea is that the dial becomes local recommendations that local public health uses. But we would always continue to promote 6 feet of social distancing, just to the point of as either guidance, most likely as guidance, because we know how important it is that everybody follow that.
Yeah, I just still think it's the inconsistencies in our society about the 6 foot, especially, with the airline industry. And I know I keep bringing it up, has never had a requirement on the 6 foot, but yet we're putting other businesses out of business with the 6 foot. So I just wanted to get where the state was weighing in on that. And then to use that off-ramp metaphor, can you give us any insight if we are indeed on the off-ramp? Will this 3.0 dial have a color that says COVID is over? Whatever color is remaining. I don't know what color is beyond blue that indicates we're done, but are they actually looking at what that category would be?
That was part of the feedback. Councilmember Grimm, through the stakeholder process, is recommending that there's one piece on the dial that shows the counties that have sort of met a level, they're sort of out of the dial, and there would be a chance to obviously snap back in if it got really extremely bad in those communities. But, you have some rural communities and they're making justifications that they have like 4 or 5 cases, and should they continue to follow the public health guidance. So I think the state's trying to weigh that as well.
Okay, perfect. Thank you. That's all the questions I had.
Somehow I feel compelled to do a metaphor. When you say novel virus, we've learned that it's war and peace, right? I think that's funny. So Jason, my question is on the college students, and it's personal because CU announced that it's going to start a vaccination program, and obviously, you and I are share, we have students up at CSU. Did they get a supply that CSU is not getting? Or I mean, how could CU announce that program and CSU not? Do you know anything about that?
Mayor, I'll need to look into it. I think they may be talking about vaccinating their faculty.
I think they were talking about students. At least that's what we saw. So I got the impression that there was a student program, and I could be wrong. And so Jennifer's nodding her head because she has a CU student, and so I mean, it was just one of those deals. As you know, the equitable distribution, the transparency of distribution is something that I'm concerned about, and that's one where that it was just interesting that CU was in a position to announce it, and the other universities were not.
I'll look into that, Mayor. I haven't heard that before. And Deb, have you? Okay.
Okay. So just to know, and so then we'll.
We just got the notice that our notice didn't say all all students. It was in the kids that are in the bubble, that are in the science program. That's the notice, and we just received it Saturday morning, Jason.
So maybe we interpreted, but I'm just curious about when they're going to start doing the college kids and how they're going to do that. I mean, I guess by the point they get there, the kids will probably be home. Well, yes and no. I mean, so it was just a question. So we'll go ahead. We'll go ahead and close out the Board of Health. So the Board of Health meeting is adjourned. There is no business before the Broomfield Housing Authority this evening. Our first item under council business is the public hearing and council's consideration of proposed ordinance number 2142, authorizing and approving a vested property rights agreement. On March 11, 2021, staff recognized the public notice requirements from the Dillon Point Vesting Property Rights Agreement, second reading, have not been satisfactorily met. So the public hearing was noticed in the Broomfield Enterprise, but staff did not provide the mailed notices and sign postings on site as required by Broomfield Municipal Code. Based on the above, staff is recommending the public hearing and second reading of the vesting ordinance be continued to April 6, 2021 to allow for mail notices to be sent and signs to be posted on site. If the matter is continued, public comment would be heard on April 6, 2021. Are there any questions from council on the recommendation to continue? Noting no questions, council should now consider continuing the scheduled public hearing and second reading for ordinance number 2142 to the April 6, 2021 City Council special meeting date. Is there a motion from council to continue the public hearing to April 6, 2021? Councilmember Lim.
I move that the scheduled public hearing and second reading for ordinance number 2142 be continued to the April 6, 2021 City Council meeting, special meeting date.
Councilmember Henkel.
Second.
Any discussion? Will the clerk please call the roll?
Groom,
Yes.
Hinkle,
Yes.
Law Evans,
Yes.
Lim,
Yes.
Lindstedt,
Yes.
Schaaf,
Still can't hear you.
I saw yes, but I didn't hear yes.
He said affirmative, yes.
Yeah, let's go ahead. It was yes.
Tessier,
Yes.
Anderson,
Yes.
Castriata,
Yes.
and I see Councilmember Jezierski has joined. So Jezierski,
I'm in the house and yes, thank you.
It passes unanimously. We will move on to, so, I mean, the matter has been continued April 6, 2021, and we'll have a public hearing at that point in time. And we'll go ahead and move on to 11B, which is a public hearing to council's consideration of proposed ordinance number 2149, regulating marijuana within Broomfield. I'll now declare the public hearing open. We will follow the city standard public hearing procedures. First, staff will present a summary of the proposal. Next, we will have the applicant's presentation, if applicable. Then we'll ask for public comments and final comments from the applicant. And finally, questions from city council. Council has a copy of the agenda memorandum, which staff will summarize.
good evening, Mayor Pro Tem, and Council. We are at second reading tonight on the ordinance for marijuana licensing. I'd like to introduce Christine Franciscani, an Assistant City and County Attorney, who will start off the presentation.
Good evening. In addition to Nancy and Pat this evening, present tonight with me is Courtney Tiemann, Brenda Ritchie, Allison Long, Brandon Rowe, and our consultant. Next slide. Here you can see our regulation timeline as we move forward. We'll be setting up the selection committee and then with the clerk starting to accept applications for review on July 2nd. Next slide, please. At the first reading of this ordinance, council approved amendments limiting marijuana businesses to 1 per street, in addition to approving requirements for storage of products and requirements on delivery services. And lastly, an increase to the number of initial licenses from 2 to 3 with a total of 5. Next slide, please. So staff is recommending some changes in order to just clarify the regulations. Adding language to the definition of good cause ensures it is consistent throughout the regulations, and using the word transfer as noted here ensures consistency with the state regulations. Next slide, please. The state's regulations for security at marijuana stores are substantial, and they cover in detail things like security alarm systems, locks, and video surveillance. Next slide. So the requirements for notice for liquor and marijuana applications are different. Some of the notice requirements for marijuana applications in our regulations that are different from liquor include publishing all complete applications and accepting comments on all of those applications. The staff will be developing procedures to ensure transparency and public engagement with the marijuana licensing process. And with that, I think I'm turning things over to Courtney.
Next slide. Hello? Okay, great. At first reading, we there were a couple council members who specifically asked about what other municipalities are doing to protect minors. And initially, we'll note that this area of business is heavily regulated. And so in general, these regulations are in place to protect the health, safety, and welfare of our citizens, which of course includes kids. But these 4 things noted here can be seen both in the different municipalities we looked at, as well as on a state level. So we looked at Aurora, Boulder, and Longmont. And we'll talk about what each location does. First of all, the prohibition of people on the premises. So both, the state as well as Aurora and Longmont all have regulations that say people under the age of 21, so that pertains to retail or the mix of retail and medical. People under the age of 21 are not permitted in the limited access area. And a limited access area is basically where the marijuana is sold or possessed for sale. Boulder, as well as the regulations in front of you tonight, Council, so Boulder and Broomfield both take that and make it a little bit more stringent in prohibiting people under the age of 21 on the premises. In addition to that, Boulder and the regulations you have in front of you tonight, so Broomfield, also require not just that IDs are checked before people come into the premises, but they're done so by the use of a scanner. And those of you who have been on the local licensing authority know that there are many times, frankly, when employees at liquor stores check IDs, look at them, and they just don't pick up the fact that the person isn't old enough to buy the alcohol. And so the scanners the hope is that will prevent that error from happening. So, okay, there's the first regulation that helps protect minors. The second piece is setbacks from schools, and you see across the board, Aurora, Boulder, and Longmont all have 1,000 feet, and that's what is also proposed here for Broomfield. Advertising. Now, the only municipality that addresses advertising specifically is Boulder, but I'm going to come back to what Boulder says. Let's start with the fact that the state regulates advertising, and they do that by prohibiting a number of different things in advertising for marijuana as it pertains to protecting kids. They prohibit deceptive, false, or misleading assertions. They prohibit advertisements that target minors. They prohibit advertisements that again are targeted towards minor, that might include things such as, and it's listed as cartoon characters or similar images. And we see that in the tobacco regulations too for advertising. For example, I think people used to, have the camel, right? But cartoon characters are prohibited now. So the state has those regulations as it pertains to advertising. Boulder mirrored those. The ones that are specific towards protecting kids, right? So no false misleading advertising, and nothing that targets minors. The last, and at present time, we do not have anything in the Broomfield from the first reading that addresses advertising beyond, what the state already has. The last piece is the confiscating fraudulent proof of age. The state allows businesses to confiscate fake IDs, basically, right? And then if they are confiscated, they must be presented to the police department. Boulder also mirrors that, right? So they allow, they explicitly say that a business can take a fraudulent proof of a fake ID and then must turn it over to the Boulder Police Department. Right now in Broomfield, we have, as listed in our unlawful acts, that it's an unlawful act to fail to confiscate the fraudulent proof of ID and notify the police department. And so that is also covered currently in Broomfield's regulations. Those were the four pieces of regulation that we saw that were specific towards minors. Next slide. And at this time, I'll turn this over to Brenda Ritchie.
Thank you, Ms. Teeman. Brenda Ritchie, Chief Financial Officer. Good evening again. After the first reading, staff had the opportunity to revisit the calculation based on council direction and to really understand the potential fiscal impacts on both the revenues and expenditures. This slide illustrates the anticipated annual revenue Broomfield expects to receive in taxes. The number is a substantial reduction from the previous estimates, and this is primarily due to the base information that was used to calculate the revenue. So the original estimates extrapolated data on revenue generated from the City and County of Denver's total number of unique locations, which is 475, as reported in their annual financial statements. However, it's been since determined that the total number of locations is approximately 180, and that's primarily due to the fact that many of the locations reported actually consist of multiple licensed entities, such as retail and medical facilities co-locating in the same area. So additionally, due to the saturation of Denver's marijuana retail, staff determined that one location could generate approximately $2.7 million in retail gross sales, which results in an annual revenue of $224,000 for both city and special sales tax for a single location. Should Broomfield permit up to 5 locations, the approximate annual revenue for taxes is $1.1 million, annually. So Broomfield would also expect to receive additional revenue from the state's ShareBrack program, which is 10% of the 15% of total revenue the state of Colorado collects. And based on those fiscally conservative numbers, we equate that and estimate roughly $190,000 in additional revenue. Again, additional other revenues that would be generated are from fees from both licenses and administration, which we don't reflect here in the table because it's relatively unknown at this time, and those fees are not set. So the various fees that we research range anywhere from $100 upwards to $7,000 based on data from different municipalities. From an expenditure perspective, there are these anticipated costs associated with programming, enforcement, and general administration of the program. Staff perceives the need of a limited term appointment position to assist with the initial establishment of the program. Additional costs outlined in the table reflect the need for training of our public safety officers with the latest regulations regarding compliance and enforcement for marijuana within Broomfield's jurisdiction, along with some ongoing administrative costs for the program delivery. And that really kind of sums up the revenue and expenditures and the projected fiscal impact for Broomfield related to the second reading. And I'll turn it over to the team on the rest of the impacts of limiting density for proposed retail locations.
Good evening, Mayor and council members. This is Allison Long with Public Health. During the previous council session on this topic, Public Health was asked to clarify what high density means. And I think that was because our Broomfield fact sheet on marijuana states areas with higher density of retailers typically have higher underage use rates. So council asked us to clarify what is meant by higher density. And so what we've learned is that, well, first of all, most of the evidence for this statement comes from studies looking at alcohol and tobacco, but there also are a few studies related to marijuana. The most common way that the studies describe density is the number of retailers per 100,000 population. And so they would typically talk about whether or not there was less than one retailer per 100,000 population or greater than one retailer per 100,000 population. And that's, of course, a way to compare cities of different sizes. So there does not appear to be the one definition of what high density means in the literature. The studies basically say, though, that with increasing number of retailers, there was an increase in youth marijuana use, and the same has been seen in tobacco and alcohol. And so then I'll just add that some communities have capped the total number of retailers in a defined geographic area, and some have set a maximum number of retailers proportional to population size. In Colorado, communities related to marijuana, basically a number of communities that we've seen have set a maximum number allowed. And then I'll also add that Boulder has taken an approach of setting their limits through distance rather than maximum number. So in other words, setting their limits through, just as we have 100, theirs is 1,000 feet from schools, but they've also said that no more than 3 marijuana businesses of any type can be within 500 feet of each other. So that's their way of sort of limiting density. And that is all I have to say on this topic.
Next slide, then. So that concludes staff's presentation.
Okay, we'll go to, I think what I wanted to do was there's some amendments that have been discussed among staff or from council with staff. And before we went to public comments, I think we thought it was a good idea to have a summary of that. So I would like to have staff share a list of the amendment topics.
We're pulling that up right now, Mr. Mayor, if you give us a moment.
I'll give you a moment.
Thank you.
And I'll, note to the public that these are the amendments that the legal counsel knows about. There could easily be other amendments, or these amendments could be changed while we consider the item tonight, but we wanted you to see the ones that have been drafted by with counsel by our legal staff. Okay, is somebody talking? Because I can't hear them.
I'm trying to get this is Todd Gilbert. I'm trying to get my screen large enough so you guys can see it.
Okay.
I think that's good. So, Mr. Mayor, the amendments that staff is aware of at this point are an amendment that would say each business can only apply for and receive 1 license. There would be amendments relating to limiting marijuana products, either based on potency or the type of product. There's a potential amendment about confiscating IDs, which is following up on Courtney's part of her presentation, is what's in Boulder's regulation and is similar to what's in state law. There's a potential amendment to remove the provision that would mandate everybody in a car be 21 or older when doing drive-through operations. There's a potential amendment to have these regulations sunset after 2 years, and a potential amendment related to signs and advertising by licensed marijuana operators.
Okay, thank you. So with that, we will go to public comments next. If there's anyone who would like to be heard, please press *3, state your first and last name and neighborhood for the record. We have Lorraine. Lorraine, please state your full name, your neighborhood, and you have 3 minutes.
Thank you, Mayor Quinn and members of the council. My name is Lorraine Trotter, and I live in the Northmore neighborhood. And I am a small business person and also a mother of 3 Broomfield High School graduates, the last of whom just graduated this past year. And I'll never forget being in a meeting of the Parent Engagement Network, which we used to call the PTA, at Broomfield Heights, and having Ginger Ramsey come speak to us. And we asked her what kind of problems she's facing at the high school and what we could anticipate as our kids moved forward into high school. And she told us the biggest problem facing Broomfield High School is that marijuana is legal in Colorado. She just said that instantly and succinctly. And we all know it's around. We know it's in the other neighborhoods. And we know that the high school kids get it and even younger kids get it. But now it's getting more potent and it's getting worse. And even Boulder Valley School District has unanimously adopted the resolution that I believe you're aware of about its potency. So I'm asking you to please don't make matters worse. Don't bring it closer. Don't make it easier for these school kids to get it. Try to keep Broomfield a bit above the fray. We have a beautiful community, but these kinds of stores do not make the community more beautiful. And from my business in municipal government, I know that although you do get taxes from it, you also get a lot of increased expenses from it. So I'm asking you to not be the council that makes matters worse for the love of the money of the taxes. And please really try your hardest to get around this and keep this marijuana, and especially this potent marijuana, away from our school kids.
Thank you, Lorraine. I'm not noting any others. Mayor Pro Tem, is there anybody in the queue? I can't hear you.
I don't see anyone in the process of being screened. If anybody wants to speak, you have to press *3.
Right. So we'll go ahead and go to the city council portion. I'll keep an eye on the screen, but don't want to limit or don't want comments to come in too quick because I think it's important council to discuss this. So questions from city council members are next. Council should limit themselves to questions during this portion. The time to introduce amendments and state positions for or against this item is later. Are there any questions from council? If so, please raise your hand. Councilmember Schaaf.
Thank you, Mayor. I do have two questions that came up due to the staff presentation. So one of those was with these scanners for IDs. And I was curious, is this an operational choice by those businesses, or is this a regulatory measure within those jurisdictions that have this use or this operation in practice?
You'll correct me if I misunderstand your question. In Boulder, the scanners are required. In Broomfield, the way we have written our regulations, the scanners are required. Different businesses could, of course, choose to use scanners in other municipalities, but it's not required. Does that answer your question?
It does answer my question. I was just curious if it was an operational choice by those jurisdictions or if that was something regulated in their code like ours is. So I'm glad to hear that's how they have been operating, is that it's a regulatory measure. And then the other question I had was that you talked about mirroring language, and one of those was, you talked about duplicative language at the state. I guess when you were talking about mirroring language, especially around advertising, and I guess a lot of it was around advertising, was that having duplicative language in the local regulations that's already in the state regulations, or is that similar language between those state language versus that local language?
Sure. Well, the first thing I want to just note in response to your question is the way that our code is written, if the state requires it, it's required here in Broomfield as well. When I talked about mirroring language, and I didn't go through and take it word for word, but I'm pretty darn sure it is, as it pertains to the advertising. In Boulder, they use the language misleading, deceptive, false, or designed to appeal to minors. In the state, they also use language such as deceptive, false, or misleading assertions, and prohibiting advertisements targeted towards minors. So the spirit and what they're saying is mirroring each other. I didn't write the exact words down on my paper tonight, though, so I don't want to say something that's not 100%, Does that answer your question?
It does answer my question, and I see that we have a possible amendment coming forth regarding signs and advertising, and I hope that some of that is clarified in there for our regulations, because I do think that that's a necessity, is to ensure that we do not have advertising that's being directed at teens. So I look forward to hearing that amendment later. Thank you. That's all the questions I have.
Councilmember Groman for questions.
Thank you. And I have some questions mixed in with clarifications, because we're going fast and sometimes I'm not quite sure if I know what we're talking about. So in regards to delivery, we did get an email after our last discussion on delivery with a list of counties or cities that allowed it. With that list, was that retail and medical? Because I did get an email from an individual that said there's only one county or city, that Aurora, that allows retail delivery in Colorado. So I kind of am having some conflict from what I got from staff versus what a resident had given me. Can we get some clarity on that?
Councilmember Groom, if you can give us just 1 second, I want to pull up that chart again, and we can, if we can come back to that question, we'll
I'll
get
go
you.
to my next question about the signs, because I am very interested in supporting the amendment that's up and coming. But with the signs include one of the popular marijuana indicators. If it's not the leaf, it's the green plus sign. So would the amendment that was proposed, would it include that emblem? Is that a question I ask with when the amendment comes up, or can I ask it now?
You can ask it now, council member. That emblem, I believe, would be allowed under the proposed regulation, under the proposed amendment.
Okay.
I'm looking at it specifically, the language that we got, which is copied from Boulder's.
Yeah. Yeah, as I read through it, it seems like it would be allowed, but I didn't know if that would be something my fellow council members would also like to incorporate, the that green medical plus, not sure what to call it, but I would be interested in adding that language. And then I wanted to ask a few questions associated with the CDPHE study and potency. So the CDPHE came out with some pretty powerful language in their study associated with potency. And I know staff also came out with an email and some information associated with potency, and thought that I'd at least have staff reiterate that information for public purposes associated with some of the other entities like Vermont that held a potency at 30% and the concentration and potency for concentration was at 60%. Can you guys just present that for public purposes, since that was in an email? I thought that was good information.
Yes, Councilmember Grimm, Allison Long did that in-depth research, so I'll have her present.
Thank you, Councilmember Groom. The part that I can speak to is, summarizing some of the information from the CDPHE and the Retail, Marijuana Public Health Advisory Committee report, who did look at, the current literature on THC concentration and basically did express concern about the concentration levels and basically said that the evidence is moderate to strong concerning THC concentration and the association with mental health effects in adolescents and young adults, adults as well. They said that the use of products with high concentrations of THC, which they define as higher than 10% THC, are associated with higher rates of psychiatric disorders such as schizophrenia, psychosis, and anxiety disorder. Specific to THC concentrate products, they said the evidence is insufficient regarding an association with dependence, in other words, addiction. And that, they said, was largely because there really aren't that many studies on this now. So it didn't necessarily say that there wasn't an association. There just isn't the evidence. But I also, we consulted with our medical officer, Dr. Urbina, and he wanted to make sure that, we communicate that the clinical guideline literature also talks about the toxic effects of THC. And I guess the takeaway is that really with increasing doses, increasing concentration, there's of course more severe adverse effects. And for first-time users, so for those people that really either haven't been exposed to marijuana at all or don't have a tolerance, if you will, those effects are potentially more acute and more severe. So that was basically the summary, I think, that we provided. Were there additional clarifications you would like?
And just one more question associated with potency. Is there any cases where medical uses of those higher level potencies is warranted? I couldn't find anything in my research where medical levels were indicated, whether medical was at 30% or 60% or 80%, it really just indicates medical. Is there any studies that say what medical is usually prescribed at? Is there a prescription level for THC potency?
So Councilmember Grimm, we didn't specifically look into that research. That would be something we would have to follow up on with Dr.
Okay. Yeah, I know that's a new question for you. I tried to look for it real quick this afternoon and I couldn't find it. So perfect. And then let's see. One other question. Do we have right now in our regulations, I know we refer to Boulder has we can't have 3 stores within 500 feet of each other. Do we have that in our regulations right now? We just talked about it earlier.
Councilmember Groom, we do. So we have the provision that 2 marijuana retail locations can't be within 1,000 feet of one another.
Oh, 2 within 1,000. Okay.
Yeah, so I guess, let me rephrase that. If there's one located at 1234 Main Street, 1,000 feet away would be the closest that the next one could be. And to build off of that, there's also the provision that was added at first reading that we don't allow more than one location on a single street. So we have a couple
Okay.
provisions that help to limit that.
Okay, I remembered that one, but I didn't remember the 1,000-foot one. Thank you very much. That's all I had. I appreciate it.
Councilmember Hankel.
Councilmember Groom. I'm sorry, Mayor. We have an answer to Councilmember Groom's question on delivery.
Oh, yes. Thank you.
So the local governments that were in the chart, Denver allows delivery of both retail and medical. Boulder allows medical delivery. Aurora allows retail delivery. Longmont is medical only. Parachute, retail delivery. And Superior is medical and retail.
Thank you very much. I appreciate that clarification.
Councilmember Henkel.
Thank you, Mayor. I have two questions. The second one is kind of, I'm going to be asking some questions out of Mr. Dan Rowland, if you don't mind. My first one is really towards our legal team. I just want to make sure that we have public clarification on the application process. I had asked in an email that we want to consider that if an applicant has a secured location as an application requirement when they apply. So are applicants required to secure a location as part of their application, and that the state also requires an applicant to have a location when they submit their state application?
Councilmember Hill, thanks for that question. Yes. So the state requires applicants to identify the location that they've secured at the time of their application to the state, and our regulations require the same thing. With the brand new application, they'll have to have a location.
You were kind of breaking up on my end. I don't know if that was just me.
No, that's me. I'm sorry.
Sorry?
That was me. I apologize. And our regulations also require that a location be identified at the time of application.
And does identify mean they have intentions of purchasing, leasing, or that they have already signed an agreement? What does that mean?
Good question. So the applicant has to show some sort of right to the property. So they could own the property, but they could also have a conditional lease. So a lease that says if they are granted a license, they will be allowed to operate there.
Okay. All right. Thank you for that answer. And Dan, I'm wondering if you could answer some questions about potency. And I know as far as, liquor stores go, if people want a certain level, of, the alcohol in their blood, you could drink 3.2 beer to get to a certain level of desired effect that you want. Would the same be true for marijuana? So could someone ingest more product to receive that same high potency?
Yes, is the short answer to that question.
Okay, so potency, as you sell it, you could still have more product, like, people could drink more 3.2 beer. So if we only sold 3.2 beer, people could drink more of it to hit that potency level. And it sounds like the same thing could happen with marijuana. They could ingest lower potencies and increase to receive that same desired effect. And would Broomfield be the first one to put limits on potency in Colorado?
Yes.
And how much do you know off the hand, and I don't know if you actually know this, but do you know how much it costs to test for potency at the state level?
I'm sorry, how much does it cost to test per potency?
Yeah, how much goes into testing for potency at the state level? And I'm curious how much.
Well, it's required of licensed businesses. So every product that's on the market is submitted for potency testing. It's not something that's done by the state. It's something that's done by licensed testing facilities.
Okay. So that would cost more. Do we have an idea as to what that would cost for a city and county of our size? Or I'm wondering if our staff has done that math.
Councilmember Hinkle, Dan, I'm sorry, this is Nancy. I'm going to jump in real quick. Staff has advised the council members asking about potency that Broomfield can't regulate in the area of potency and get into the business of testing. We think that area is clearly preempted by state law, and so that wouldn't be a cost that Broomfield, I don't believe, would be able to take on. So we didn't do an analysis on cost of potency. The proposed amendment related to potent products has to do with regulating products based on the label that the state mandates. So if a product says it has 15% THC, that's what our inspectors would look at to decide whether that should be or should not be on the shelf if that amendment passes. If that clarification is helpful.
Okay, thank you. So, all right, thank you. I'll leave my comments for later on that. Thank you.
Councilmember Anderson.
Thank you. I do have a couple questions, and first of all, following on some of the questions that Councilmember Hinkle just asked, I guess I'd have a question of, some of this is new to many of us, the dabbing of the shatters and the waxes and the rosins, and I guess I would be curious, is the high that one would get from dabbing these high potency products, is that equivalent to ingesting multiple edibles or smoking more marijuana flower product? Are those equivalent, or is that a different type of effect that you would get from that?
Councilmember Anderson, staff doesn't have the information, and we didn't do research on product type to prepare these regulations.
Okay, and that wouldn't be, I know that Mr. Rowland was answering some of Councilmember Hinkle's questions. I wasn't sure if he had information on that or is not, no.
I would simply say that the routes of administration are different, so the body metabolizes it differently. And the THC level of a product does not necessarily dictate the level of impairment one will experience from it, nor obviously does it dictate how much of that product one would consume.
Okay, thank you. And then back to my original questions. I had sent a list of questions on that all of that Attorney Nancy Rogers had sent to all of council, and I just want to kind of ask a couple of these and how we proceed. One of the last questions was about future data and really being able to track some of these negative outcomes that BVSD and Adams 12 indicate that they're experiencing. And I think the answer was, it does not have to be in the regulations, and that would be a future topic for discussion. And that also relates to the other questions regarding those stipulations for when council could address these regulations again, such as if we saw an increase in youth access or if addiction rates were increasing as we're tracking data. So I'm just curious, when is the appropriate time for, I am absolutely in support of collecting that data, revisiting the regulations, and making sure that we are doing the best that we can to protect our youth. When and how would we bring that discussion forward regarding the tracking of data?
Thank you for that question, Councilmember Anderson. You could bring that forward at any time under 18A as a council member request, and either to collect more data, to ask public health for help on that, or to have legal and the clerk's office to look at the regulations. That could be at the 6-month point, the 1-year anniversary, the 2-year anniversary, whenever the council member would like.
Okay, thank you. And that's all of my questions.
Okay. I'm not noting anybody else that wants to ask questions because we're going to go into the motion, the discussion of the amendments. It's 7:44 right now. It makes sense to go ahead and take our break at this point in time. So let's take a break till 7:50. Oh,
I just have
Mayor,
one quick question. I'm sorry.
Go ahead, Mayor Pro Tem.
My hand went up a little bit late. I guess this question could be for our attorneys or Mr. Rowland. Having worked in the retail cannabis sector for a while, would you say that Broomfield's proposed regulations on retail and medical cannabis sales are some of the most restrictive compared to surrounding communities?
Is that a question for me? I'm sorry.
Yes.
Mr. Rowland.
Oh, okay. Yeah, so they are very good. I would put it that way. And having spent time with staff going over the ordinances and the different changes, I would say that they've done a really fantastic job of incorporating kind of the best practices from other jurisdictions that we've seen. I've worked a lot at the local level, and there are certainly programs that are more restrictive, but I think what Broomfield has crafted here is a very sensible approach to this, and you're exercising your local control in I think really prudent ways. So all in all, I think it's a thoughtful ordinance.
Well, I appreciate your input. Thank you.
You're welcome.
Okay, so we will then go to break. Let's go ahead. I mean, since it's 7:46, let's go ahead and break till 8 o'clock. And at 8 o'clock, we'll read the motion and start the amendment process. So council is adjourned till 8 o'clock or on break till 8.
The Access Live event is in music hold.
So Roger, take us off break once the clock strikes 8.
All right.
Music hold ended.
Okay, welcome back, everybody. The break of City Council is over. We are in the process of discussing a proposed ordinance number 2149. There being no further comments, I'm going to close the public hearing right now. And so we're going to go into then council's consideration of proposed ordinance number 2149. Will the clerk please read proposed ordinance 2149 by title?
Ordinance number 2149, regulating marijuana establishments within the city and county of Broomfield. Second and final reading.
Is there a motion? Okay, I don't think I'm at the place is there, I don't see any hands up. I mean,
I'll do it.
Okay, Councilmember Schaaf.
Thank you, Mayor. I move that ordinance number 2149 be adopted on second and final reading and ordered published in full.
Mayor Pro Tem.
Second.
Okay. So before we start the discussion, I wanted to share again with everyone the list of amendment topics. Nancy, you want to go ahead and put your slide up?
Yes, we will. Can you see that, Mr. Mayor?
I can. Thank you. No, perfect. Are there any additional amendments that council wanted to add to this list at this time, just so we can keep track? I'm not seeing any, so we'll go ahead and move ahead. I want to open the floor for discussion by council on the entire proposed ordinance and the possible amendments. Per our rules, each member will have 5 minutes to speak on the first round, 2 minutes on the second round. After that discussion, we can consider the motions to amend. Is there any discussion? Mayor Pro Tem, I'm having trouble seeing.
I know. Thank you,
Mayor
Mayor,
Pro
but
Tem.
I heard you. Well, I am proposing the one license per business amendment, ensuring that one company can't apply or
That's a good amendment.
for most, for more than one application, so that we have these 3 licenses that will be fairly distributed among 3 different operators or businesses. So it just made sense to me, especially since we have this lottery now, that one business could end up with all 3 licenses. So this amendment takes care of that.
Okay, any other comments? Oh, Councilmember Tessier.
I wasn't going to comment. I was just going to second.
I don't think we've had a motion yet for that amendment.
Now, Mayor, you want us to discuss all of the amendments at once?
Yeah, I mean, this
Okay.
is, the way it's been scripted, so, obviously everything gets changed, but this is the 5-minute part. And so any comments council has on the ordinance itself and the amendments, make it now, because the goal would then be to limit it when we're just debating each amendment to have it to 2 minutes. So that's what we're talking about doing. So this is the overall comment period.
Then I'll continue on with
Okay.
comments, if that's okay,
Yeah, please do.
regarding the restriction of the potency levels. I just don't think this will prevent young people from accessing cannabis concentrates. If high potency cannabis is even close to as dangerous as the opponents claim, they really do support cannabis legislation and regulation, then why on earth would they want to force these products into the illicit and unregulated market? In the illicit market, no quality control of product, safety regulations for manufacturing, or barriers to acquisition by minors exist. All the cannabis in the world was illegal for 100 years, and it was still easily accessible in high schools and colleges. Forcing a small segment of cannabis products back to the illicit market will not prevent today's youth from getting them. In fact, it will only make it easier. As far as putting young people at greater risk, cannabis concentrates comprise about 1/3 of the legal market, representing hundreds of millions of dollars in annual sales. Recreating demand for illicit cannabis concentrates among adults will increase access for young people by increasing the supply of unregulated concentrates. This will make illicit cannabis even more available than it is today, where supply is restricted and identification is confirmed. It will also create inaccurate and mixed messaging for consumers and youth. The THC level of a product does not necessarily equate to the amount of THC an individual will consume, nor to the level of impairment that will exist. Establishing an arbitrary dividing line between potency levels could lead consumers and youth to assume that products below a certain level are safe. Responsible consumption is different for everyone, and youth should not be consuming cannabis outside the supervision of a physician. Medical cannabis is not like the traditional pharmaceutical industry. Patients generally don't know how much they consume unless they're using edibles, and even then it varies. The beauty of cannabis, especially for chronic pain patients, is the ability to self-titrate. Each patient is different. Every day is different. Effects vary by strain. Some days you do need more, some days less. It's wonderful to be able to adjust your dose accordingly. Cannabis affects people differently, and some people prefer lower potency products, while others prefer higher potency products. Some prefer consuming as little as possible to experience the desired effects, while others enjoy consuming more. Surprisingly, there is demand for a wide range of products and potency levels. So the key is sensible regulations that ensure consumers know what is in each product, and education so that they understand how the product will affect them. Concentrates allow for quick relief, which is useful for a host of reasons, deemed medically sufficient for a doctor to recommend the use of cannabis, including severe pain, seizures, and muscle spasms, to name a few. Concentrates also tend to be cost-effective, which is vital for patients. Many cannabis patients are forced to live on a fixed income as a direct result of their medical condition. They also allow better control over dosing, unlike with edibles. Many patients will carry a vape pen for exactly this reason. High potency cannabis is more efficient for many conditions, including epilepsy and chronic pain. Cannabis with higher potencies does a better job of treating the condition. This is why patients seek out high potency medical marijuana. That's what I have on that one. I do actually support the confiscating of IDs that Councilmember Lim is proposing. I think it's definitely an advantage for us to have those IDs locally if they are confiscated, so that we can use it to track and mitigate any patterns of abuse. I support Councilmember Henkel's drive-through for no one under 21 in the car, just obviously because adults do go through drive-through pharmacies to get narcotics and pharmaceuticals and medicine. So I don't feel like we should add that burden to people who are trying to get their medicine if they can't arrange for childcare. I can't support the sunset provision after 2 years. I believe that makes this a very unviable option for business owners who are going to invest a lot of time and money and effort into applying and then complying with our regulations. So I think that would be a huge deterrent in getting the best operators if they knew that it could all go away in 2 years. On the signs and advertising, I do support the limitations on the certain words, signs, and deceptive ads. So those are my comments. Sorry, I went a little long.
Yeah, thank you. Councilmember Lim.
I obviously am proposing an amendment that would be to the operational requirements in 542-250 on the confiscation of fraudulent IDs. So this amendment would be specific to operational requirements, and it does, as staff pointed out in their presentation, fulfill part of the regulations as they would relate to protecting minors. So I did ask questions also of the Broomfield Police Department, which the answers were copied to all of council, that the Broomfield Police Department said that if they receive these fraudulent IDs and they would notice a pattern of fraudulent usage, then they would do some kind of investigation. So that would be good in relation to the protection of minors. And then I also asked the Broomfield Police Department if they would be able to give us an annual data on how many fraudulent IDs they were seeing in the stores. And they also answered that question affirmatively, that this could be requested as part of the data that would be given to council. So I certainly think this is a good step to solidify Broomfield's regulations, to put this in the operations requirements. I had one other comment on one of the amendments that struck me as I listened to the staff presentation. So the staff emphasized that there is a prohibition on anyone under 21 from being on the premises. So it struck me that in a drive-through situation, that it is similar to being on it is an extension of the premises, I would say. So in that context, it doesn't seem to me to be unusual that you would be 21 as a requirement in the car, because it is required within the premises. So I was looking at it through the lens of the presentation from the staff. And I think those are my comments for now. Thank you.
Councilmember Anderson.
Thank you. And I will give a more in-depth overview of the amendment for the high potency marijuana that I do intend to bring forward. But first, really quickly, I am in support of one license, confiscating IDs. For the drive-through, I was going to suggest, and I don't think that the sponsor is amenable, but for those under 21, if they are a medical ID holder, I could see an exception for that, but I do see the conflict of being on premises. Regarding the sunset provision, I want to hear more from Councilmember Law Evans, but I absolutely think we need to be revisiting these regulations. Maybe after 6 months, every year, we do need to go back and make sure that we're not doing something that's resulting in adverse impacts to our community. And signage, I am definitely interested in learning more on that one, what they're thinking. So regarding the amendment to prohibit sale of high potency products, back in 2012, when the question to legalize marijuana in Colorado was brought forward, marijuana was less than 15% THC concentrate. The marijuana industry since that time has evolved, with the majority of marijuana products greater than 15% THC, and new products such as shatter, wax, and other concentrates at levels on average of 70 to 80% THC and even up to 95 to 99%. BVSD recently passed a resolution on high potency marijuana products, and Adams 12 will be voting on a similar resolution tomorrow night. I take seriously that these school boards, who know their student population better than we do, are concerned with the growing market of marijuana-based products available to their students, including dabbing and shatter, that are higher in potency and present in greater negative outcomes for our students than traditional marijuana products. Additionally, understanding that they have determined that marijuana use is consistently one of the top 3 reasons students are suspended from school, resulting in learning loss, as well as increasing costs to support the student, including among some of their most at-risk students and students of color. Perhaps should be enough to do what we can to limit access to these particular high potency THC products. We should not normalize a drug that is branded as medicine, which is incredibly confusing to our teenagers. This is along the lines as do as I say, not as I do. And unlike prescription narcotics, with strict limits on the number of pills, often lasting just a few days to get through a surgery or some other pain, a medical marijuana ID provides continuous access on a daily basis. And I'm not sure if that's, you have to renew that annually or how long that goes for. You can continue this process and it does lead to addiction. It is important to base our decisions on available data and science. From the CDPHE July 2020 report, THC concentration in Colorado for marijuana, these statements approved by the Retail Marijuana Public Health Advisory Committee, RMPHAC, are concerning. THC can cause acute psychotic symptoms such as hallucinations, paranoia, delusional beliefs, and feeling emotionally unresponsive during intoxication. These symptoms are worse with higher doses. Another statement from this board. High THC concentration marijuana used by adolescents and young adults is associated with continued use and development of further mental health symptoms and disorders. And inhaling THC concentrate may be associated with higher blood levels of THC when compared to smoking marijuana flower. Additionally, they report that substantial evidence that inhaling more than about 10 milligrams of THC, which is about 10 to 20% of a currently available marijuana cigarette, is likely to yield whole blood THC concentrations near or above 5 ng per milliliter within 10 minutes, which can be used to support a conviction for driving under the influence. And that was at the 10 to 20% level, not up in the 70 to 80 or even 95 or 99%. I had requested the addition of an exemption for individuals with a medical marijuana card for patients that are prescribed high THC concentrations. However, I was able to find information that no valid science exists to validate medicinal cannabis greater than 10% THC. Since all concentrates are above 10% THC, I'll return to the original amendment for not distributing or transferring the specific high potency concentrates. And I honestly don't think without having this amendment, which takes us so far away from what the voters passed in 2012, that I could actually support these regulations. And additionally, there's state agencies. The Marijuana Enforcement Division has the authority over production, distribution, and sale of marijuana. The CDPHE, Marijuana Health Monitoring Program, monitors marijuana use trends across the state and the emerging scientific evidence of health effects related to marijuana use. And we as local jurisdictions have the authority to require additional licenses and may enact laws that build upon rules and regulations set at the state level to protect public health and safety. Thank you.
Thank you. Councilmember Tessier.
Thank you, Mr. Mayor, and thank you for the really thoughtful comments and hundreds of questions that this council has asked. I also want to thank staff who've worked diligently to bring forth information as well as answer all those hundreds of questions. And I think the public can see that pretty much nothing that comes before council is easy. And the topic of marijuana is no different. I do support the one license for business. I think that's fair. I'm not in favor of a prohibition or on selling products. Research done around the globe used the United States as an example when prohibition went into effect in the 20s, and it actually led to more crime. Not saying that that will, but that was an interesting topic. But I do support the idea of maybe a marijuana task force that can bring to light some of the concerns that I think my fellow council members have. Much like the oil and gas task force, Broomfield's kind of was put on the map, and we created a lot of information. The CDPHE used that information. And I think that we have an opportunity here. And I think that maybe a task force could kind of help the staff in obtaining some of that research. I do not support the sunset, and the reason why is because I would support a task force more than a sunset. Also want to state that as a mother of two teens, or one teen and one tween, I'm really torn about this issue. I speak with my children very candidly about drugs, and it still scares me sober sometimes when I think about the damage substances can have on our young brain. And as many in this community, I grew up in a household where addiction to substances was not unusual. We all have our personal stories and tragedies about addiction or misuse or abuse of substances. Because of my family tree on both mental health and addictions, I've dedicated my life to studying public health, holistic health, and human behavior and transpersonal psychology with a certification in addiction studies. And I do believe that Gabor Mate's belief about addiction. Addiction is a side effect of something that is much more powerful, and that's human suffering. And when we look at why people use drugs to become addicted, a few things typically come up. Escape, to numb feelings. It's fun, makes you feel good. It's a distraction. It's a way to self-medicate for mental illnesses that are largely stigmatized in this country and in American culture. I also know that most people that try drugs do not have a problem with drugs, but most who continue to misuse and abuse and are addicted to drugs will continue to exacerbate human suffering until we are able, as a nation, as a community, to address human suffering and mental illness. And we are going to continue to see a drug use, abuse, and misuse problem. Now, the National Survey on Drug Use and Health Data indicated that 48.2 million Americans aged 12 or older used marijuana in the past year. Approximately 4.8 million people aged 12 or older in 2019 had a marijuana use disorder in the past year. I think it's important. I'm a huge proponent of proper education for our youth. Programs like DARE have been epic failures, costing millions of dollars over the years. We need to be telling the truth about substances. We can't just say no to drugs and then provide no reasons. Our youth are way smarter than our adults give them credit for. When we respect our youth, they in turn respect themselves. When we let our youth know that chronic use of marijuana leads to depression, anxiety, and can increase risk of schizophrenia for those that are already predisposed and may lead to a psychotic break for those who are not predisposed. And when we learn about the brain chemistry to find out what neurotransmitters make them happy, such as serotonin or excited, your adrenaline, nourished, oxytocin, stimulated dopamine, we can figure out ways to naturally induce these releases in our brains. We've heard of the runner's high, and that is a real thing. And as an avid runner and a way to not follow in the footsteps of some of my family, I ran, and I ran a lot because I like that runner's high. Yeah. And it provided me a positive escape and positive feelings like the endorphins and the higher tolerance for pain. Our efforts to support mental health and addiction cannot be solved by throwing more money at without getting to the root of the human suffering.
Sharon, I need you to wrap up.
Yep, I'm going to wrap up, Mr. Mayor. I don't talk a lot, and this time I'm going to say a few things. If we can be sure that, so I think one of the things that the task force could also do is look at the correlation between if there's increased numbers at VVSD and Adams because of the 3 medical marijuana establishments, then we can adjust. I think when we know better, we do better. And with regard to the 21, it's interesting, we can bring children to the liquor store with us.
Yeah.
We can pick up a bottle of wine, and it doesn't mean that the parent is giving their child alcohol. I'm flexible on the ID. I don't
Sharon,
necessarily.
Let me come back to you once we've gone through a round.
I'm just about finished. I got 2 more sentences, Mr. Mayor. I also support the sign and advertising limitations and do support the confiscation of IDs. So that was it. Thank you.
Okay. Councilmember Lindstedt.
Thank you, Mayor. I appreciate the time to speak, and I appreciate all the work that staff's put into these regulations and for taking the time to work with us on all these amendments over the last, several weeks and months. This has been no small task, and I think these regulations are in a really good position to move forward. So I just wanted to say thank you to staff for all that work. In terms of the amendments tonight, I think the one license per business one makes a lot of sense. I do intend to support that. I'll come back to the THC potency one at the end here. I think confiscating IDs makes a ton of sense. And I don't have a problem with the drive-through amendment. I will not be supporting the sunset provision. And I have no issue with the advertising limits. And, you know, I think what's great about the whatever, 1, 2, 3, 5 amendments I just listed, they are not very substantive in nature. And I really appreciate my colleagues who brought them forward, you know, bringing forward things that are small and non-substantive on the second reading, the day of the second reading. I got to say, with this limits on THC, I'm a little annoyed that we're bringing such a substantive amendment that we haven't had time to analyze, that we don't understand the repercussions from, that we don't have a thorough legal review of, except, you know, we got something shot back to us right before the meeting tonight that I was trying to read while we were doing this presentation is coming forward. I think it's a little unprofessional, and I really wish that, you know, there would be some etiquette when it comes to really substantive amendments the day of a second reading vote. You know, we've had months to address this, and I don't appreciate it. So I'll be opposed to it. You know, one of the best things about legalization was that these high potency items became regulated. A lot of folks remember before legalization, these still existed, and you know, people were making them in their houses and blowing up their homes. Like this happened regularly. These are not new things to the world. You know, there was a black market for these same products. They're dangerous to produce, and you know, they're not new. So what legalization did is they brought them into the light, and they created a regulated way for them to be produced. So I don't support this amendment. I really wish it had come to us sooner so we could actually have a full understanding of what it would do. And I think we can monitor the situation later and see if there's really a problem here to address. These same products are all around our community and our neighboring communities, and I just don't see the need to put what I view is a poison pill amendment in these regulations the day of second reading. So I'll be a no, and I really do appreciate all the work and time from staff and from my colleagues on this body to make a really sensible and strong set of regulations. Thank you, Mayor.
Councilmember Jezierski.
Thank you, Mayor. Yeah, I will start by echoing the thanks that Councilmember Lindstedt put out there to our staff and our legal office. They were certainly very busy and very responsive, particularly over the last week. So I think they did a great job on this. I do really appreciate that. As has been noted, I do plan on offering an amendment today that addresses signs and advertising. It does basically take it word from our neighbors to the north, Lafayette and Boulder, who have both passed these almost exactly the same type of amendments. The first part of what I'm proposing does put a prohibition on using the words pharmacy, pharmacist, and similar type of phrases in the name of an establishment. The second paragraph of what I'm proposing addresses, and I think this is the one that sort of mirrors our state laws, but it does address deceptive advertising and advertising towards youth. And the third section does put a prohibition on the advertising of products under certain mediums. So I'm happy to take any questions on that, I guess, at a later time, but those are taken directly from Boulder and Lafayette, so it's nothing that's been made up or nothing new. On the other ones that are out there, I'm a bit torn on the THC potency one. I think there's a legitimate concern there, and that was evidenced by the letter from the Adams 12 school board that we received today. So, you know, I think there's real concerns. On the other hand, I do see the concern of putting our establishments on a bit of an uneven playing field. I guess it would sort of be likened to having our grocery stores be required to, and I guess they were at one point, sell 3-2 beer. while everyone else was selling regular strength beer. So a little torn on that one. The one I do want to address is the drive-through that's being proposed by Councilmember Henkel. I think she'll be talking briefly after me. And I want to suggest sort of a little bit of an amendment to that proposed amendment. And it's my understanding, and if I'm wrong, certainly correct me, but it's my understanding that the real concern is if a parent is going to pick something up and they have their child in the car, they don't want to be prohibited from being able to use the drive-through. And if that's the real concern, then what I would propose is just making an exception for immediate family members. So it would still be no one under 21 can be in the car, except if you're an immediate family member of the person purchasing. I think that makes sense. I think it limits the what I would consider maybe the more legitimate concern of a bunch of college kids going through the drive-through, where only one of them is of legal age, and then the rest of them being underage and most likely consuming, on the spot. I'm sure they'll find a way to get that marijuana one way or the other, but it does make it a little more difficult for them if you have that restriction still in place. But if we're concerned about a family member or a parent being able to pick something up with their kids in the car, I think we can address that maybe a little more directly. So I'm looking forward to hearing Councilmember Henkel's thoughts on that one. And then I don't have any concerns with the one license per business. I think that's a great idea. And I would probably be against the sunset provision. I think I heard the one comment and it made sense to me that if we're going to have business owners putting in some money and energy into the business improvement, they need to have some confidence that they'll be here for more than a couple of years, because it is a big startup cost. So I get that, and I think I addressed about campus gating IDs. I'm okay with that. Thank you.
Councilmember Henkel.
Thank you, Mayor, and thank you, staff, for working even on a snow day yesterday. I saw these emails flying yesterday, and I just really appreciate it. I know a lot of us had a lot of digging of snow that we had to do at home as well. So I really appreciate all your work, and thank you, Dan, also for being here tonight and for your time and your efforts and your content knowledge. It's very important for us to understand exactly where we draw the line and where we educate. And I think this is where we need to really draw this lens. Many of you know that my husband is a combat war veteran, and he cannot own a medical ID because he also wants to conceal carry. So when we talk about delivering medical marijuana, well, that kind of puts him in an interesting spot here where he can't have that and also conceal carry. So then you're putting these combat veterans in a choice between doing that or having their sidearm. When we talk about drive-through, I'm going to just talk about that one first because this one alerted me in my head. I have a family in Broomfield in my ward who has a 5-year-old that needs it medicinally. And while I appreciate Councilmember Jazierski's adding on there, I did think about that, and I thought, man, what could we do to just include family members? That would be really hard to prove, and I don't want to put that on our businesses to have them prove if they're next of kin or not. There's no documentation of that. That would be really hard for those who also might not have, an ID or whatnot. I don't know how that would work. I just don't think that would just take too much investigation on the company's part. So, my husband wants to be able to drive through though and have his daughter or his niece with him and have them, on the premises. Now I'm wondering if our legal counsel can, sort of disseminate the difference between on the premise or using the drive-through. I know that we had, other people comment on that. Can I use my time right now to sort of ask that? Could we put something in the amendment that says, if you're on the premises, but you're also using the drive-through only, you can be on the premise inside the car? I just don't want to tell our families that you can't pick up, your products. So that would be helpful.
Yes, thank you, Councilmember Henkel, for that question. We were talking about it after that question came up. Premises is the actual building, the four walls of the building. So a car driving into a parking lot for a drive-through window wouldn't be on the premises for these regulations.
Okay, all right, that's really helpful. Yeah, I feel like we're punishing the wrong people and we're kind of really overstepping. It is a felony, and I really want people to know this. And if we need to make signage at the drive-through, hey, it's a felony to give someone marijuana that's underage. You know, that would be a good deterrent, and I'm okay with that. We also need to make sure that we're doing the education. So going to the product limitations on THC and the potency. I talked with Kathy Plomer on the school board today, and we really kind of landed on, you know, she told me that there's just a lot of advertisement towards youth, and with higher potency in youth, they had those concerns. The other concerns for the being suspended from school were not only marijuana, but they're also, I asked her the other two, which is violations of code of conduct and insubordination and defiance. And when I was a high school teacher and I did some more investigating with these kids, there was more going on than just substance abuse. We had a lot of housing insecurity. We had a lot of food insecurities. And so I really want to make sure that we're looking at this in a holistic view. It's not just that marijuana is accessible to them. I want people to know and understand there's a reason that they could be going to marijuana. They could be escaping, you know, the fact that there might not be enough food available, or there might not be, you know, housing options for them, and they're stressed. There's other, you know, intersecting problems that we could be having. And I think the sign and advertising, I support confiscating IDs, I support sunset provision, I do not. I would like to follow if we are seeing, you know, more incidents with youth and youth usage, but I just really want to make sure that we're looking through this lens of we don't want to punish those people who use it lawfully and may not be able to have a medicinal license. And a lot of people know their limits, just like we do with alcohol. So I just really appreciate your time tonight. That's all I have for now.
Okay, the county attorney, city attorney would like to answer a question. I'm not exactly certain which question she's going to answer, so she'll tell us.
Sorry, Mr. Mayor, I was able to cover the entirety of the answer to the question when I spoke to Councilmember Hinkle, so I think staff has it covered. We're good.
Okay, good. So then we'll go to Councilmember Law Evans.
Thank you, Mr. Mayor. I appreciate the opportunity and I appreciate the discussion so far. In the past couple of weeks, I wanted to say that I was greatly impacted by the letters from BVSD and from Adams 12, from those school boards, talking about the dangers that what they're seeing, the dangers that they're seeing out there. We also got, well, I assume it was sent to everyone, but I'm not sure, a couple of emails today from Robin Noble, a board member on the City of Boulder's Cannabis Licensing and Advisory Board, that had some very, very interesting things to say. And I read through everything today. We received a lot, took a long time, as y'all know, but one of the things that was in the email from Robin Noble really struck me, and I want to go back to this. I worry a lot about the young people, and as I've shared with council and with some members of the public, I guess with everybody who's listened, I have a family member, my older sister, who's been schizophrenic now for about 50 years, give or take, since she was a junior at Broomfield High School. Ginger Ramsey was not the principal then, but this has been an ongoing problem for a long time. The main difference is that now we have these far higher potency products that are out there. And what I understand is that there's a pipeline where young people can get the higher potency stuff. They call it a gaping loophole, Robin Noble did. And there's a website Boulder Opt Out, I think is the name, Opt Out Boulder. And they say, they make the comment that young people between 18 and 20 can obtain a medical marijuana card with virtually no scrutiny. All it takes is a quick appointment with a doctor, often found on the internet. Once they have the card, they can buy up to 2 grams of high potency THC drugs, a large amount. Then they become social resellers of these drugs to their younger peers. This is thought to be the most prevalent pipeline of high THC drugs into Boulder high schools. And I assume that Broomfield high schools are no different in that respect. So I'm pretty worried about that. And I'm worried about the kids that are out there right now who might be like my sister, dabbling in this because of the mixed messages, and possibly going to end up, as my sister has, being, she functions at the level of, say, a 3 or 4 year old, something like that. She's never held a job. She's always lived in Section 8 housing in her entire adult life, never held a job, been supported by the government. So I would hate for some other child and some other parents to go through what my sister and my parents did. So with regards to the specific amendments, I am fine with the amendment on licensing, 1 license per business. I really appreciate Councilmember Anderson bringing forward the THC limits. I think that's a crucial next step. I think that confiscating IDs is fine. I can't agree to, why are we intentionally going out sending mixed messages to children to youth under 21 in the car? Why are we intentionally setting this up to do that? So I am not prepared to go along with the delivery amendment. And then to skip over my own to Councilmember Jezierski's very thoughtful amendment, I'm fine with that. I want to talk about my proposed sunset amendment. Please note that the way that Nancy Rogers and I have worked on this, if you look at the email from Nancy, and I can't really read what it says on the screen because my glasses aren't that good, but the marijuana regulations would automatically sunset after 2 years, and a moratorium would go back into effect unless council specifically extended the regulations. And the reason that I want to go through this is because, as witnessed by the number of amendments that are coming forward tonight on second reading, and the confusion about this fact or that fact and the question marks, I would say it's almost guaranteed that we are not going to get this right this go round for Broomfield. I don't care what Longmont does. I don't care what Denver does. I don't care what anybody else does. We're not going to get this right in one pass with Broomfield. And so my thinking with the sunset provision is to say, to put a built-in pause in there. Yes, I know the barriers to entry are high, but it will incentivize those people, those companies that do come into Broomfield to work with us, potentially on Councilmember Tessier's idea of a task force, and get it right.
Because I need you to wrap up, Liz.
We're just not going to get it right in the first pass. So that's my plug for a sunset provision. That's all I have, Mr. Mayor. Thank you.
Thank you, Councilmember Grove.
Thank you. I'll quickly go through these. I want to say yes to the 1 license per business. I think it's a great idea. Yes to the sign and advertising. Would love to add something in there associated with the green first aid sign. Not quite sure what to call that. A yes to confiscating a fake ID. I would disagree with no one under the age of 21 in the car if it's not allowed on the premise. Just set the stage for no one in the drive-through either. We can visit that at a later date. I am a little iffy about the sunset provision after 2 years, only because setting up a business is of this size and magnitude is a significant business endeavor and investment. So I would hate for people to think that after 2 years, the stability of their business after possibly making a profit in 2 to 3 years, the council could shut it down. So I am, because of that reason, leaning more towards maybe it's not fair to a business getting set up. So I'm still kind of wavering on that. I do want to talk about the THC, and I want to talk directly first to Councilmember Linsett for calling out some of his fellow council members in somewhat of an unprofessional manner. Please seek to understand first, because there were some of us that brought up the importance of THC levels. And we did hear the legal advice associated with not being able to do much with our regulations locally until we found a solution and a way by using the state labels. And when that was brought to us, we did find an avenue, and that is why we're bringing it up and bringing it forth. So it's not like we've sat on it and waited. It is a solution that we're bringing forth, and we think that we can bring it to Broomfield and make a difference. So especially when our schools, our two largest school districts, BVSD and Adams 12, and I'm paraphrasing, are calling upon elected officials and the governor of Colorado to support legislation for control and limits of THC potency for marijuana. Additionally, CDPHE states moderate to significant health effects with THC potencies over 10%. And we all know here in Broomfield what it takes to have CDPHE take a health and safety standard, especially on oil and gas. We waited for years and years on that. So for them to come out publicly and establish a health and safety against THC levels over 10% is pretty outstanding. And I do want to remind everybody that the protocol in the state of Colorado is not to wait for the state to weigh in and make a regulation. They have clearly said local government first. And I want to say Broomfield was a leader in oil and gas health and safety, and the state followed with 181. Broomfield listened to our local school districts and our local health departments, and we eliminated the sale of nicotine products and vaping products to 18 and 20-year-olds, and the state followed. Broomfield and surrounding communities insisted and institutionalized community public health for COVID pandemic masks, and the state followed after we did it. Broomfield needs to take the lead and stand with the schools and surrounding communities and say no to high potency marijuana and not wait for the state to figure it out. So I do plan on supporting a higher level, controlling high level THC regulations, because we do need to be a leader and stand up and show our youth and show our residents that we can have safe marijuana sales in Broomfield and stand for something, which is health and safety in Broomfield. So that's where I stand with these regulations, and thank you very much.
Okay, Councilmember Schaaf.
Thank you, Mayor. I appreciate staff's work and engagement on this conversation as these regulations for marijuana have been researched and crafted for Broomfield. I also want to thank the public for your input on these regulations. I've heard you loud and clear about keeping marijuana out of the hands of youth, with the caveat with those youth monitored by a physician. We do have those cases here in Broomfield. I want to thank my fellow council members for their engagement in this discussion over the last 9-10 months while we've been discussing this. I do appreciate council members continuing to be engaged in working through questions and working through concerns. I do have concerns about access to marijuana by our youth and really any other substance by our youth. it doesn't go amiss by me. The goals, I think, starting with that one is restricting access for youth. I do have a zero tolerance for stores selling to youth or knowingly selling to someone that is selling to youth. Just within our Broomfield, discouraging abuse of marijuana and other substances. This is why I think it's critical that our revenue does go primarily to Health and Human Services, and goes to address that abuse of substances. I want to ensure that our businesses are set up to succeed in a safe and responsible manner, and I believe that these regulations do that. So I think that with those amendments, the one that I want to address is the product limitations based upon THC potency. I'm going to be a no on this, but I really do appreciate the work and the research that at least one council member, if not more, have done on this. To better understand this area of our regulations, this does seem to be a current conversation for our school districts as well as our state. And I do look forward to gaining more information as that conversation moves ahead. I think instead of setting up a task force, which provides, does take resources to do, I would like to ensure that our staff is engaged in those state level conversations, to follow those conversations as they go through the legislature, but also through the departments, to ensure that we are up to date on what that conversation looks like, and to ensure that we can pivot when we do get more up-to-date information. And I think that there is also the option to continue to engage as elected officials with those state legislatures on that issue as well. So I think that this one is as another council member put it, is a sizable conversation, and perhaps one that we can continue to have moving forward. I think the state is still having that conversation, and marijuana has been legal within Colorado for years. So that's the only one that I really want to address during these comments. But again, thank you to the public, thank you to staff, and thank you to my fellow council members.
Okay, we'll go through there's a couple people who want to make second set of comments, so we'll be limited to 2 minutes. I have Hinkle and then Lindstedt.
Thank you, Mayor. There was just a few things I wanted to address when we talk about people in the car. If you're under 21, then that means that you can walk next to the car and you can just wait until they purchase. And then after you're done purchasing, they can get back into the car. So this is the part where we talk about where is our regulation and where do we talk about education. And so we're telling people as well that you can go pick up narcotics. They're highly addictive. Throw them in the car. You're trusting them with the education of that piece. What you're actually telling the Serrato family, and I don't know if you guys read their emails, but you're telling them, dear Serratos, you cannot pick up medicine for your kid in a drive-through. They're okay with not going in the store, that's fine. But you are telling this family that they cannot pick up medicine for their children in their car or their child. So this is where I'm getting really fired up, because I don't think it's very fair. I don't find it very, I don't find it adulting, to be honest with you. I feel like we are really shaming these families who need it. I feel like we are trying to over control something. This is not even a state level. I believe that we would be the only ones in the state to do this. And again, we can pick up much heavier substances. I can bring my daughter into a liquor store. I can buy tons of liquor, and we could actually drink until we die. And I want people to understand that that's where the education begins. So I don't want us to tell this family, you cannot bring your child to get your medicine and have them in the car with you. I'm also concerned too that people might be tempted to leave their children in the car, go inside, go and purchase or go drive around and then come pick up their kid again. This is just, it's unnerving, and it's very, it bothers me a lot, because we can go to pharmacies and I can have children in the car and I can buy much more harmful things. Thank you.
Councilmember Lindstedt.
Thank you, Mayor. Yeah, I just wanted to reiterate that it's a possible felony charge to direct marijuana to people who aren't of age. A felony. I mean, it's very heavily regulated, and I just think we're really overreacting with this possible THC limit to the letters from the school boards. I think we should make sure we're being clear on what the school boards asked. They asked for the state legislature to address this. They did not ask us to do this. Let's not misrepresent what they said in the letters. The letters asked the state legislature to address it. And it's tricky. We approved this lottery system to limit legal risk. And now here we are saying at a 5 o'clock amendment on second reading, let's become the constitutional test case on these sales. And I really think this needs to be a more drawn out discussion and not added the day of. I just want to reiterate that. I think it's prudent for us to fully assess the impact of adding these limits to our regulations, especially with such short notice. So that's all I have to add, Mayor. Thank you.
Councilmember Lim.
Mayor, can I still address a question to staff related to these amendments?
Yes.
Okay, my question is related to the prohibition of people in the car under 21 in the drive-through. My understanding is that was proposed by staff, well, the Broomfield Police Department. That was something that they proposed to staff. So is that understanding correct? And if so, can the staff represent why the Broomfield Police thought that was important, or is Chief Krieger on the line who can convey that information?
Good evening, Mayor and Council. Gary Krieger, Police Chief. So we heard, as we were drafting the regulations, a lot of concern by council on controlling the possibility that minors would receive the marijuana. So it was really a choice. In the regulations, looking at a bunch of college kids or others who might drive up, and one of them being 21, and the purchase occurring and then the distribution, that's what we are attempting to prohibit. But obviously, there are outcomes of that may be negative, as outlined by Councilmember Hinkle. So it really was just a reaction or a response to the concerns that council had, and then obviously the discussion for council in making a decision.
Okay, thank you for that response. That's all I have. Thank you, Mayor.
Okay, Councilmember Law Evans.
Thank you, Mr. Mayor. I just wanted to highlight something that Councilmember Lindstedt just said, that with regards to some of these amendments, we need more time to study them. And I appreciate Councilmember Lindstedt basically proving my point that we're not going to get this right the first time around. And that's why I would like to have a built-in sunset provision unless council does extend it. And when I make that, I did hear loud and clear that maybe 2 years is too short. So when I make that proposal for the amendment, I will be making it 3 years, and I look forward to Councilmember Lindstedt and anyone else supporting that amendment. Thank you.
Councilmember Groom.
Yeah, I want to just emphasize the point where I definitely can empathize with the families of children or the families that need the medical marijuana. I just want to make sure that we're not driving retail marijuana sales regulation based on the need for medical marijuana. And if it's so significantly different needs, maybe we have 2 different facilities. And maybe that in itself is a discussion, because I do empathize and I do understand, but I want to make sure that if combining the 2 in one facility does not make sense, maybe that in itself is the discussion. Maybe we should have 2 facilities, one for medical marijuana with its own regulations, and one for the retail marijuana with its own safety precautions. And then I do find it interesting that this council were the ones that had a significant interest to change laws associated with youth vaping and tobacco smoking. We need to be just as concerned associated with youth and marijuana smoking, and the THC potency levels for our citizens. So thank you very much.
I was going to go ahead and allow the city attorney would like to make a comment. Nancy?
We just wanted to touch on the reasoning behind the medical and retail co-location. It was in an effort to address youth access to marijuana, because in medical facilities, by state law, you could be 18 to enter a medical marijuana facility. For retail or co-located options like we're proposing here in Broomfield, you have to be 21 to enter the facility. So that was the reasoning behind this. And as I'm being heard in the past, this was something that was discussed in depth during the study session. So just bringing up that background on that issue.
Thank you. Mayor Pro Tem?
Thank you, Mayor. I thought Councilmember Anderson was next. Some of my colleagues have addressed the CDPHA study, and one thing that I want to add is the report made no conclusions. It also added the lack of evidence in these areas, paired with the little evidence that was found in other topics of interest, limits our ability to assess the full health impact of these products at this time. Our ability to make unbiased, evidence-based statements on the potential health effects of marijuana products containing high THC concentration is limited until further scientific research can be conducted and the evidence shared or published. I'd also like to add that the professionals in the Colorado marijuana business and the state of Colorado have instituted the highest standards for management, quality, purity, and potency, proven for more than a decade of legal trade in Colorado. Broomfield should take advantage of these resources and not duplicate them. Boulder and Adams County aren't considering a THC potency cap, so we are not preventing consumption. We're just continuing to send consumers right outside of our boundaries, thus losing the revenue. This needs to be addressed at the state level to have any impact. And lastly, Broomfield, and these are some great words from a resident. Broomfield does not need to be in the business of other people's business. Professionals at the state have well-defined standards for the production and testing of marijuana, including potency. It does not make sense for Broomfield to duplicate the service and professional judgment already provided by the state. Thank you.
Councilmember Anderson?
Thank you. I do want to respond to just a few of these comments. Alternatives were proposed to allow immediate family members or individuals under 21 with a medical ID card in the car at the drive-through. So we have tried to be amenable while still addressing that initial concern of the 21-year-old with some other not quite of age adults or youth. I want to reiterate that when marijuana was legalized, the average concentration was below 15%. I think that is so critical because this is not the marijuana that was legalized back in 2012. It has greatly changed over these past 10 years. The amendment to prohibit sale of high potency products was brought forward after second reading when we received the email from the Boulder Valley School District School Board regarding the resolution, and more recently Adams 12. That resolution was not brought forward that resolution was actually brought forward last week, not today. And it was also raised before the first reading, but I don't think we had quite gotten the attention that this can actually be done. And now we previously restricted all sale. We can certainly restrict certain products going forward. And I do want to respond to our Mayor Pro Tem's comment about the CDPHE study, for which I quoted earlier. And in the conclusion, evidence is moderate to strong concerning THC concentration and the association with mental health effects in adolescents, young adults, and adults. So they do have moderate to strong. There was other areas that were still forming, which is in the specific types of marijuana, because this market is ever changing, and they are the studies are struggling to keep up with these changes. So the public health statements that have already been made based upon high evidence, including that THC can cause acute psychotic symptoms such as hallucinations, paranoia, delusional beliefs, and feeling emotionally unresponsive during intoxication. And these symptoms are worse with higher doses. That is a public health statement that has already been put forward. So just to not confuse that those have already been made. Thank you.
Okay, Lori, thank you. Councilmember Anderson. Councilmember Hinkle, we've already had 2 rounds of comments. We're going to go through the amendments now. And if you want to comment on your amendment, then you can comment at that point in time when you propose your amendment. So let's go ahead and go through what I'm planning on doing is calling on the member that has suggested the amendment, have them make the motion for the amendment. If there's a second, then we'll allow additional discussions not to exceed 2 minutes, and then we'll vote. And these are on the amendments. Keep in mind that there is a motion and a second for the overall as presented by staff regulation. So I'm going to go with Mayor Pro Tem Castriota first.
Thank you, Mayor. And may I ask our driver of this? Thank you. So just for clarification, I am amending what's in red. So I will read that. Ms. Gilbert or Francescani?
Yes, that would be correct. If you could just read the language in red that you want to be adding. The other edits are just so we fix the lettering.
All right, thank you for the clarification. My amendment is that 1 license per business, no person or entity shall apply for more than 1 license in any location in the city, and no owner of any business applying for a license or in possession of a license within the city may apply for or be an owner of any other business entity applying for another license in the city.
Councilmember Tessier,
Second.
is there any discussion? Will the clerk please call the roll?
Jezierski,
Yes.
Law Evans,
Yes.
Lim,
Yes.
Lindstedt,
Yes.
Schaaf,
Yes.
Tessier,
Yes.
Anderson,
Yes.
Castriota,
Yes.
Groom,
Yes.
Hinkle.
Yes.
It passes unanimously. So let's go to the second amendment. And I'll call upon Councilmember Anderson.
Thank you. And I am going to, it's actually, do we want, I was going to actually bring forward the language of R, which is probably the next slide, but I do believe that Councilmember Groom may want to bring forward still a piece of Q. So we should do R. We could maybe do R now and then go forward from here.
Are you not proposing the rest of it then?
No, I was going to propose R.
Okay, then we'll have a separate vote on R.
And I can do R now. Okay, so
And then I'll call upon Councilmember Groom.
okay, that is good. So this is under the operational requirements, and the thought here was originally to remove provide an exemption to allow medical users access to the more high potent products, because we thought maybe that was something to relieve pain. But since then, I have been doing much research and been in contact with multiple people, and I have found the information that I was looking for. And unfortunately, I provided this way too late to staff. But the all studies of smoked medicinal cannabis showing benefit have been done with less than 10% THC. I have it's a reference with Whiting, PF, Wolf, RF, Dash Panday, S. I have this study here if anybody wants to see it. And additionally, no valid science exists to validate medicinal cannabis greater than 10% THC.
Yeah.
So
Lori, why
Mayor,
don't you make the motion and then we can have a discussion?
Oh, sorry. Oh, the language. Sorry. Okay. So the language here, I would like to return to the original language that had started off that marijuana establishments shall not distribute or transfer or offer to distribute or transfer. And then this list here, concentrated marijuana products used for the process of dabbing, including wax, shatter, butter, crumble, bubble hash, rosin, live resin, sugar, sauce, crystalline, or equivalent. And then remove the remaining sentence.
Okay, staff, did you get that?
Councilmember Anderson, if you could send me that language, we can get it up on the screen. If you have it typed up, that would either in chat or by email, and we can put that up on the screen.
I do. I will email it to you right now.
Meeting will access, right?
And I took the original language that you had provided before added the medical exemption.
Just to read it.
Yeah, could you just read it again, Councilmember Anderson, please?
Sure, and I just sent it with no subject. Sorry. It is, I lost my, okay, so marijuana establishments shall not, and I think it's the same from there. Yeah, so marijuana establishments shall not, and then from distribute on, it's the same. Yes.
Got it, good.
Yep.
Okay, would you, Lori, would you read, or Councilmember Anderson, would you read that and confirm that what your motion is?
Sure, it's
on the screen. Just confirm that represents.
Oh, not read. Yes, that yes, that represents.
Yeah, no, just read it quietly.
Okay, sorry. It's good.
Okay, Councilmember Evans, was that for a second?
Yes, second.
Okay, any additional discussion on this motion? Councilmember Lim?
I just wanted to reiterate Councilmember Schaaf's expression of appreciation for what Councilmember Anderson did to begin research on this topic. And I'm also, in case it needs a second, I would also second the fact that I would like the staff to follow the statewide conversations on this issue. And if there's information that comes forward from state legislation that may be passed or additional information that from CDPHE or something like that comes forward, that we are completely and immediately, as much as possible informed about that information about potency, so that we can have further conversation at another time. So thank you.
Okay, City Manager Hoffman.
Mayor, if it would be helpful, Pat Gilbert would like to speak to the efforts, the current and ongoing, not just efforts, but activities to track and monitor not just legislation, but policy and conversation as they occur. Pat?
Yes, thank you, Ms. Hoffman. Our staff, our attorneys, and myself and Nancy are very involved in this legislation as well as other legislation throughout Colorado. So we're on listservs. We're involved with CNL, and these issues are discussed among my colleagues, legal colleagues, and we exchange ideas. So we are monitoring what happens with the state legislation, as well as what other communities are doing proactively or in response to that legislation.
Thank you. Councilmember Schaaf.
Thank you, Mayor. I just wanted to clarify with the amendment maker. Originally, this was just going to be focused on retail marijuana establishments and not medical marijuana establishments. So this seems much more restrictive in that it applies to both medical as well as retail marijuana shops. And I just wanted to ensure that that was the intent to require this of both retail as well as medical.
Councilmember Anderson.
Yes, to reiterate, as I was bringing this amendment forward, originally there was a discussion amongst some council members that perhaps we wouldn't want to limit the medical access, but upon further research and better understanding, that this dabbing of concentrates is not for medical purposes. So to give free access under a medical ID for something that really isn't required, and that we would not have any tax additional tax basis from, did not, and it only helps to make that accessibility. So it was removed because it was just an evolving discussion. So it is for both retail. It would be applied to both retail and medical.
Okay. Well, I appreciate that clarification. I just wanted to confirm that that was the intent. So I appreciate that. Thank you. That's all I have, Mayor.
Mayor Pro Tem. You're muted.
This is even more of a disincentive, but the CDPHE is actually reaching out to lawmakers right now because they're discussing other cannabis legislation, and they're saying that proponents of this cap are actually misquoting the study. So, you know, we're going on somebody's research, but it's absolutely not true that people wouldn't use these higher concentrations for medicinal purposes. So I just wanted to add that. Thanks.
Okay, noting no other comments, I'm going to go ahead and ask the clerk to call a roll on the amendment proposed by Councilmember Anderson.
I say it failed.
I said failed.
What was
Law
that?
Evans?
Oh.
She's getting ready to
Yeah,
say that.
okay.
Yeah, there you go.
Law Evans?
Yes.
Lim?
No.
Lindstedt?
No.
Schaaf?
No.
Tessier?
No.
Anderson?
Yes.
Castriata?
No.
Broom?
Yes.
Hinkle?
No.
Jezierski?
No.
So I have it failing 7-3. And I guess, I'm not exactly certain what to do right now with that failing, but my understanding was that we have two queues. I guess I'll go to Councilmember Grom and ask the attorneys whether.
Mr. Mayor, we'll fix the lettering as they get passed. That's
Okay.
why Pat changed this one to Q, but Q is still open for grabs, for lack of a better word. Yeah.
Is that a legal term?
Yeah.
So I'll call upon Councilmember Groom.
Okay, perfect. I'll wait for them to change the slide. I just want to put in number 1, 30%, and change it to consumable, non-edible, non-medical marijuana products. So basically is what I'm proposing is, and I wouldn't have any constraints, we'll leave the state for edible products. And there's so many non-consumable, non-edibles that will get confusing. It could be an additional conversation. But what I'm proposing is there in number 1 that we limit the THC level even with CDPHE saying greater than 10%, there is a lot of states and counties that have limited THC concentrations at 30%. So I'm proposing a 30% THC concentration for consumable, non-edible, non-medical marijuana products.
Again, so is there an item two?
No.
So it's just one, you're just proposing Q1, right?
Yeah, Q1.
So part two needs to be deleted, yeah. Okay, so you want to go ahead and why don't you go ahead and read your, as a motion, read your amendment?
Sure. So marijuana establishments may only distribute or transfer or offer to distribute or transfer the following: consumable, non-edible, non-medical marijuana products containing no more than 30% active THC concentration.
Councilmember Law Evans?
Second.
Okay. So
Mr. Mayor, we're just going to clean up the formatting, if this is okay with Councilmember Groom. There's no
Yes,
need
please.
for a sub one. Okay, thank you.
Yes, I understand.
Okay, so I'll let the motion stand with the second. So now we're in the discussion period. Mayor Pro Tem?
Thank you, Mayor. Well, I have a question because this seems like just an arbitrary number that was made up. What percentage of the products sold would be eliminated by this amendment?
Well, we did have, and I don't have it in front of me, how much, I want to say, maybe staff could help me on the percentage of consumable non-edible sales. I think it was 40-some% is the percentage of sales, but there wasn't any traceability of the THC concentration of how that was broken down.
So you're saying 40% of the products available would not be available? So
No, I'm saying that the category of consumable non-edible was greater than 40% of the total sales.
I'm really confused by this. These amendments on the fly are hard for me to follow. It sounds like you're eliminating 40% of the products that would be available next door in Boulder, Lafayette, North Glen. Is that what you're saying?
No, I'm saying that 40% of the total sales comes from the category of consumable non-edible marijuana.
That's a lot. Okay, thank you.
But there's no breakdown of how much of that is over 30%.
Right. Okay, thanks.
Okay, any other questions or I guess we're in comments? Will the clerk please call the roll?
Lim,
No.
Lindstedt,
No.
Schaaf,
No.
Tessier,
No.
Anderson,
Yes.
Castriata,
No.
Broom,
Yes.
Hinkle,
No.
Jezierski,
No.
Law Evans.
Yes.
Okay, I have that feeling 7-3. We'll move to the confiscating IDs by Councilmember Lim.
Okay, I move to amend the regulations with 5-42-250 amendment under operational requirements that states confiscation of fraudulent IDs. If a licensee or an employee of a marijuana business has reasonable cause to believe that a person is under 21 years of age and is exhibiting fraudulent proof of age in an attempt to enter a marijuana business or to obtain any marijuana or marijuana product, the licensee or employee shall be authorized to confiscate such fraudulent proof of age. Within 72 hours, any fraudulent proof of age confiscated shall be turned over to the Broomfield Police Department.
Councilmember Tessier,
Second.
any discussion? Will the clerk please call the roll?
Lindstedt,
Yes.
Schaff,
Yes.
Tessier,
Yes.
Anderson,
Yes.
Castriata,
Yes.
Broom,
Yes.
Hinkle,
Yes.
Jezierski,
Yes.
Law Evans,
Yes.
Lim.
Yes.
It passed unanimously, so we'll go to the drive-through. Councilmember Henkel.
Thank you. I'm giving my son a hug and then I'll be right with you. I move to amend, what are we looking at here? Sorry.
It's on the
Am I just
screen.
moving to strike number 2?
Okay, I mean, that works, right? So is there a second? Councilmember Tessier,
Second.
is there any discussion? Councilmember Henkel.
Thank you, Mayor. Before I wanted to talk and address Councilmember Anderson's request to see if I was amenable for only medical for pickup on the side of a building through drive-through. But not everyone who uses marijuana needs a medical card, much like cold medicine. And my husband can't have a medical card because he wouldn't be able to conceal carry. So I want to make sure that we're not punishing our combat vets. I want to make sure we're not punishing our grandparents who have knee pain and they have their grandchildren with them. They're not next of kin necessarily. And so I just want to make sure that we are, giving access to those who need access and not trying to over control the further system. And I'm all for not, making it more accessible to our youth, but they could easily just walk down 100 yards, less than that, and obtain the same product if we're concerned about that. But I think that is more on the lines of education. Thank you.
Councilmember Jezierski.
Thank you. Yeah, I just want to mention that I'm not going to be able to support striking this entire paragraph. As I mentioned earlier, I totally get the concerns that Councilwoman Hinkle raised regarding having family in the car. Just as an aside, I was at King Soopers the other day with my wife. Came back from the gym, didn't have my wallet. We tried to buy some beer. They refused to sell to her because I didn't have an ID, which I thought was kind of funny. So I get having family in the car. So if this was tailored to just add an exclusion for family members, I would be all in favor of that, and I would support that. But I would not support striking the whole thing. I think it does make it slightly harder for teens and young adults to get it. I agree that they'll figure out a way, but this is it requires an extra step for them to do that at least. So that's why I can't totally strike all this. But if this didn't pass for some reason and you wanted to try the alternative, I'd probably support that.
Councilmember Anderson.
Thank you. I just want to clarify for Councilmember Henkel that my comment was it would have been for obviously the person over 21, such as your husband, could easily drive that car. They're old enough. They don't need to have a medical license. So he could still go. That this was for allowing Ethan to be in the car with his medical ID card and still be there to get the product that he is going to use. Or I would have, or Councilmember Jezierski's option of family or just something, but I really, something to address so that we can keep the component that brought this forward in the first place, which was trying to prohibit a car full of teenagers or something along that line. So I just want to clarify that it was not aimed at adults to have medical IDs. Thank you.
Councilmember Henkel.
Just so you know,
Yeah.
we have kids in the car too that are siblings as well, so they wouldn't be able to have siblings in the car. Thank you.
Okay, I'm going to go ahead. Any other comments? Questions? Go ahead and call the roll.
Schaaf? Yes. Schaaf?
Yes.
Tessier?
Yes.
Anderson?
No.
Castriata?
Yes.
Broom?
No.
Hinkle?
Yes.
Jezierski?
No.
Flaw Evans?
No.
Lynn?
No.
Lindstedt?
Yes.
And the mayor votes yes, so it passes. We'll call upon. I mean, Samantha, you had a 5-5 on that as well, right?
Yes, sir.
Okay, so it passes on the tie vote. Let's go to sunset provision after 2 years for Law Evans.
Thank you, Mr. Mayor. I appreciate the opportunity. And as I heard from different council members, and I agree that 2 years for the sunset provision was a little short. So Ms. Rogers and company, I'm going to attempt to read this and modify the dates to March 31st, 2024, which I believe then will be 3 years. So you tell me if I miss one, but that's the modification that I'm making for this. So 5-42-090 sunset provision. A, except as stated below and without further action by city council, the terms and provisions of this ordinance and the regulatory scheme provided for in this chapter 5-42 shall expire at 11:50 p.m. on March 31st, 2024, and no further licenses shall be issued and I don't understand that. Well, and no existing license shall be renewed under this chapter. Anyway, B, any marijuana establishment holding a license as of March 31st, 2024 may finish the term of that existing license unless the license is suspended or revoked pursuant to chapter 5-42 or state law or regulation. The provisions in this chapter setting forth the rights and obligations of existing license holders shall remain in effect until all existing marijuana establishment license terms have expired. C, with the exception of those establishments completing the terms of existing licenses, the operation of retail and medical marijuana stores within the city is prohibited after 11:59 p.m. on March 31st, 2024. And finally, D, at any time prior to March 31st, 2024, City Council can consider the effectiveness of this ordinance at achieving its stated purpose, and City Council can affirmatively act to extend or remove this sunset provision. Thank you. That's my motion.
Is there a
My
second?
substitute.
Is there a second? Okay, I'm going to go ahead and say that the motion fails for lack of a second, and we'll move on to the signs and advertising. Councilmember Jezierski.
Thank you, Mayor. My question is, do I have to actually read this whole thing? Because it's actually, I mean, it's out there on the record. I'll ask legal counsel.
I know this one is really long, so if there's no objection by council, Mr. Mayor, if you can ask if there's no objection, Councilmember Jezierski can present this as written on the screen.
And are there more paragraphs than just those two? I believe
There are two screens.
There we go.
So we have R, what
You
is,
don't have to read it.
Okay. And that's, okay. So, yeah, I mean, I would propose an amendment, was it 542-250, adding a subsection R, it looks like, as indicated on our screens there. I'm happy to take any questions.
Councilmember Jazierski, just before we get the second, are you okay with staff's suggestion, the edit that's on sub R3?
I did see that earlier today, and yes, I'm okay with that.
Okay, thank you.
Okay, Councilmember Tessier,
Second.
any discussion?
Mayor, I'm on a separate computer and can't raise my hand again. So could I ask a question?
Yeah, I'll let you go first, Councilmember Groom, and then we'll go with Councilmember Schaaf.
Sorry, I had to switch computers. My question is, if we could go back to the description, maybe this is it. I just wanted to make sure that the green international sign, I wanted to see if we could put that in there somewhere. The green plus sign. It's actually
Outlaw the green plus sign, and I guess I'll ask Councilmember Jazierski if he'll accept a friendly amendment.
Yes, under the provision that if it failed because of that, I could reassert my amendment without it.
I don't think you can.
Oh.
Can't you not do an amendment to the amendment and then I go back to mine?
I get it.
Yeah.
Okay.
Yes?
Yeah.
Okay.
Okay.
I'm sorry, Mr. Mayor.
Okay, but Nancy, we're talking about, but if this would fail with that one addition, we can't bring it back up again.
Yep, I get it. We'll do an amendment
So
to
what
amendment.
we do this amendment, and then she offers an amendment to this amendment.
Actually, it would be Councilmember Groom's amendment first. She can present the amendment to the amendment. Council would consider that amendment on the green cross and vote that up or down, and then we'd go back.
I follow you. Councilmember Groom, do you want to make an amendment to the amendment?
Sure. Could someone guide me into where I should make the suggestion, except as otherwise provided?
Yeah, Councilmember Groom, if you give us a minute, can you see some black text that's been added to the screen?
Oh, there it is. Yes.
Okay, let me make it a little bit bigger. So we would put this in.
Yes.
So we would
that is actually, I looked it up while we were doing some of the other amendments, and it is the green cross is an international pharmacy symbol. So that's one of the reasons why. So there is my amendment to the amendment. Thank you for letting me add that. So
Roger? Yeah, thanks.
Okay.
Okay, Councilmember Law Evans?
So I second Councilmember Groom's amendment. I think I need to, is that correct?
Yes. Okay, so we have a motion and a second to the amendment as in black on the screen on the screen. Is there any discussion? Mayor Pro Tem.
Thank you, Mayor. So this is just a symbol for a medical marijuana store. It's not a pharmacy. It's medical marijuana, which is what we just approved, or we're going to approve. So I don't understand what the purpose of this is.
So the green cross or the green X,
It's a cross.
yeah, is actually the symbol for marijuana. It's becoming a symbol. So I want to take that from our signage to make sure that it's not represented in Broomfield as a medical or a marijuana sign in Broomfield.
Why?
So from the street, people don't see it as a marijuana business.
Do you want to hide the businesses?
I just don't think that anything indicating a strong marijuana facility is, I mean, if we're worried about it being so close to our residents or schools or anything like that, keeping it from being identified as that type of business.
But you do want the customers to find it, right?
Yeah, so.
Point of order, Mr.
Yeah,
Mayor, is the back and forth
Yeah,
appropriate?
yes, I agree. Well,
This just
Mayor
was
Pro Tem, do you want to
introduced.
make your?
This was
go
just
ahead.
introduced tonight. I mean,
Yeah.
we had no advance notice, so I have questions.
Well,
Nancy?
the sign in advertising was, and it was just an idea I had in this amendment. So I guess you have an opportunity to vote no, Guyleen.
Thank you.
Okay, Councilmember Law Evans, did you want to make a comment?
No, sir, thank you. I just, I didn't think that the back and forth was per our rules and procedures. Thank you.
Okay. Councilmember Anderson?
Yes, just a very quick comment. I do support Councilmember Groom's amendment. This sign is associated with medical, and that is very confusing. Sounds a confusing sign to those viewing it. Thank you.
Okay. Will the clerk please call the roll?
Anderson,
Yes.
Castriata,
No.
Groom,
Yes.
Hinkle,
No.
Jezierski,
Yes.
Law Evans,
Yes.
Lim,
Yes.
Limstead,
No.
Schaff,
Yes.
Tessier.
No.
Okay. Samantha, would you confirm what the vote is?
The vote is 6 yay, 4 nay.
Okay, so it passes. So we'll go back to the original, the as amended amendment from Councilmember Jezierski. Is there any additional discussion?
I don't think we need to go there because she passed the entire thing, right?
No, we just passed the amendment to the amendment. We now need to vote on the entire thing.
No.
So
Mr. Mayor, we're voting on Councilmember Jezierski's amendment
as
as
amended,
amended by Councilmember Groom, which already passed. Is that correct?
correct.
Thank you.
That's what our attorney advised us to do, and that's what we're going to do. So I'm going to go ahead and ask for the roll to be called. Oh, Mayor Pro Tem.
I thought we would have an opportunity to consider this amendment without this addition.
This is what the city attorney said we should do.
Okay.
When you have an amendment on the floor, you can have what's called a secondary amendment. Somebody that proposes changing that we'll just call it the Jezierski amendment. So the Groom secondary amendment would modify the Jezierski amendment, so it passed and has altered the Jezierski amendment.
All right, thank you.
So I will call the roll, or ask the clerk to call the roll. I'm not going to call it.
Castriata, Broom,
Yes.
Hinkle,
Yes.
Jezerski,
Yes.
Law Evans,
Yes.
Lim,
Yes.
Lindstedt,
Yes.
Schaff,
Yes.
Tessier,
Yes.
Anderson.
Yes.
It passes unanimously. I'm going to call, oh, that's it. So now we'll go to the all amendments have been considered. Are there any further amendments? Councilmember Anderson.
Thank you. I am not sure if this is an amendment or a Section 18 request. So I just want to reiterate what Councilmember Tessier brought up earlier about the potentially adding a task force as we go forward. And I also believe from the email earlier response that in order to track some of these metrics and put stipulations in place on all of this, is that all for a Section 18 request following today, or would there be any amendment if we desired to create some kind of marijuana task force as we're moving forward with these amendments?
Nancy?
Because we'd want a lot more information about what the task force would be made up of, what their charge would be, how often they would meet. Section 18 request is the best method to move forward on this.
Okay, so then we'll go ahead and we'll vote on the ordinance as amended this evening. Will the clerk please call the roll on the ordinance as amended?
Castriata.
Yes.
Broom.
Yes.
Hinkle.
Yes.
Jezerski.
Yes.
Law Evans.
No.
Lim.
Yes.
Lindstedt.
Yes.
Schaff.
Yes.
Tessier.
Yes.
Anderson.
Yes.
Okay, it passes 9-1. And we'll move on to the pre-project review of Anthem Community Park Phase 3A. Council has a copy of the agenda memorandum, which staff will summarize.
Thank you, Mayor and Council. Katie Allen, our City and County Engineer, will walk us through this item. Katie?
Thank you, Ms. Hoffman. Good evening, Mayor, Mayor Pro Tem, and City Council. Katie Allen, City and County Engineer. Next slide, please. So Anthem Community Park is a 93.7 acre park located between Sheridan Parkway and the Northwest Parkway, and it's east of Lowell Boulevard. The original plan for the park was approved in 2003 with the Anthem West PUD Managed Growth and Development Agreement, or MGDA for short. The park was planned to be constructed in phases with certain improvements, the responsibility of the developer, and then other improvements are the responsibility of Broomfield. The park is sort of divided east to west by Franco's Community Ditch, and the area to the west is already developed. The area to the east is owned by Broomfield, and in its entirety, it's called Phase 3, and we've further divided that into Phase 3A and Phase 3B. In May of 2019, Council approved an agreement with Velo Solutions USA to construct an asphalt bike pump track, and it's kind of shown in the middle of the Phase 3A area. And we completed that project in August of 2019. In October 2020, October 27th, actually, City Council approved an amendment to the park site development plan and also an amendment to the MGDA. In that amendment, the developer responsibilities were changed so that they are required to install sanitary sewer across phase 3, perform the overlap grading and the erosion control, and provide a cash in lieu payment of $3,160,546 as their final contribution to satisfy construction of their improvements. And they were also required to complete the design effort for the entire park. Our 2021 CIP budget includes an additional $1,051,919 to complete phase 3A. And if you combine that with the developer contribution, we have a total of $4,212,465 to construct the phase 3 improvements. So the developer is finalizing their design and sanitary sewer construction and grading operations are happening right now. And that is anticipated to be complete by June 2021. And so now that phase 3A is a CIP project, our project manager dived into the details a little more in evaluating the construction and also the budget. And we are proposing a slightly different boundary of phase 3A. Next slide, please. Okay, so in looking at it, the parking lot to the south drains to the east. In order to drain it, we actually have to build the storm sewer under the eastern half of the parking lot. So our recommendation is to build that entire parking lot since we need that infrastructure in place. And while we're doing it, we also recommend building the entire water line. And additionally, the improvements to the northwest of phase 3A, they drain also to the east. And so it's important that we construct the stormwater detention ponds. So in order to get a phase 3 project that is constructible and functional, we are proposing to actually take out the one youth ball field, the southwest one, and do more of the parking lot and utility improvements. The plan would still include what is shown, both parking lots, a 12-foot wide pedestrian bridge over community ditch, 2 pavilions with picnic tables, sidewalks, trails, the mountain bike trails, a playground, and the landscaping. Next slide, please. So this just sort of highlights those changes a little more. The purple is the detention ponds we need to construct. The darker yellow and the pipeline underneath it is the parking lot and the extension of the storm sewer system. The blue line is the extension of the water line, and the red would eliminate the one youth field from phase 3A. Next slide, please. Also at the October 27th council meeting, council asked for this project to specifically come back for a pre-project review, which is what we're doing tonight, because there was a concern about the distance from the northwest pad site to this park. So we have laid out 4 dimension lines for you. One to the western boundary of phase 3A. One to the western boundary of phase 3, which is also phase 3A. One to the eastern boundary of phase 3 or phase 3B. And then we also dimensioned what was the phase 3A limit and also what is the new proposed phase 3A limit. So that's what those dimension lines are there for. And then next slide, please. So just to summarize, we've modified the scope slightly to be more constructible. And if council does want us to proceed with the modified phase 3A, we will proceed with bidding the project next month, April. We plan to have a construction agreement award to council in June, and then construction would occur in the summer and fall. And that concludes my presentation, and I'm happy to answer any questions.
Okay. We will go to public comments. Anybody who would like to be heard on the modifications to the ball fields up at Anthem, please hit *3. I'm not noting anybody, so I will go to Councilmember Anderson.
Thank you. I do have I think it's just actually one question on the timing of phase 3B. And currently I did look at the 5-year plan, and there's funding coming up in 2023, 24, and 2025. And I'm just curious if we anticipate that construction of the actual ball fields, because we've got this like really nice parking lot now with the not having the ball fields there. And I'm just, I guess if I know there's no guarantee, but if there's a estimated timing for when those ball fields would be constructed, that could be helpful. And I will note too, that the timing might actually be beneficial, so that some of this is not constructed until after some of the oil and gas development goes forward. So maybe the timing is right, but I'd like to know more about the timing. Thank you.
Yeah, thanks for the question, Councilmember Anderson. So the future phase 3B, I think will be looked at with Clay Shuck and with PRAC for prioritization into the CIP. It was set in the out years and it was split primarily to balance the 5-year plan. But each year we relook at those projects and try to put them in the most appropriate year and with updated costs. So I think he'll be taking a hard look at that to see if he needs that program sooner or if he wants it fully funded in 2023. And that'll largely fall into his court and with PRAC to look at with our input on construction timing.
Thank you.
Councilmember Groom.
Figured out how to raise my hand on this computer. About how much would that one ball field be? How much are we saving by removing that from the scope?
Councilmember Grimm, I'll have to get back to you. Our project manager couldn't attend tonight. He
sure, no worries.
Got trapped out of state with the snowstorm.
Oh, from the snow, no worries. I guess I'm kind of in the same boat as Councilmember Anderson. It'd just be hard to have that parking lot, and it'd be a great add in 2021 to keep that scope. But I would have no idea how much money we'd even be talking about. It'd be just interesting. I would be, of course, in support of what you guys are proposing. I understand why you're moving that scope around, and it makes good sense engineering wise. So I support your recommendation. But I would just be interested to see how much that extra ball fill would be. So thank you for bringing this to us.
Sure. As a follow-up, and I can talk to the project manager, and we could bid it as an ad alternate, which just means if we happen to get good pricing, it's already there in the pricing, and we can just move forward.
I would like to see, before you take just my opinion, what some of my other council member buddies would like to see in that pricing before you move forward, but I would support that, at least getting the pricing for it, and then making a decision off of that. I think that's a great recommendation. Thank you.
Councilmember Lamb.
I appreciate the fact that this project was that we're seeing it in a different way than was originally planned because of the interest in trying to figure out when the oil and gas development will occur at the Northwest Pad. So when it comes back to us in June, it will be for phase 3A as it is proposed here. Or are you saying now that you would possibly bring it back for construction phase 3A plus this small ball field?
Councilmember Lim, all of our budget estimates are just estimates, and we really don't know the pricing until we get bids. If there's a desire just to bid what we have in the plan shown as 3A, that's the simplest thing to do. If council wants to move forward and see what else we can get, we can bid another ball field as an ad alternate to see if we have the funding or if we want to get that pricing this year.
It's a little hard for me to support a ball field going forward before we know what we're going to determine with our own reverse setbacks. I'm a little more comfortable with a parking lot where people are not sedentary very much and standing there exposed very, very long. It's a little more difficult for me to support a ball field, not knowing how we're going to set our reverse setbacks. So that's my comment.
Other comments or direction? Councilmember Schaaf?
Thanks, Mayor. I just want to put out my opinion as well. Basically, that last statement by Councilmember Lim was exactly what I was going to say, which was, 3A is a great plan including that parking lot, is fine, but I wouldn't go further than that. I wouldn't consider a ball field as well. So I like that. Exactly what Councilmember Lim said, it even better than I did. So I'll just leave it at that.
Just a reminder for council, we're coming back on March 30th with those reverse setbacks.
Yeah.
So again, we wouldn't be able to do a whole lot of bidding and outreach and engagement within the next 2 weeks anyway, with regard to that additional add-on for those ball fields.
Mayor Pro Tem.
Thank you, Mayor. My question is, so we don't know what the reverse setback would be for a ball field yet, then, because we're still having those conversations. But using the 2,000-foot guideline that we passed for oil and gas, I do concur with Councilmember Lim that I kind of want to wait and see what happens in the next couple of weeks, unless this is time sensitive and we have to. No, we have time. Okay, then I'm for revisiting after we have the larger conversation, if we can. Thank you.
I'm not sure you got the direction you needed, but you got. I mean, we really do have to have the reverse setback conversation.
Yeah, Mayor, I think right now we'll just bid 3A, and if we have other ways to add in a ball field if that's desired later.
Okay, appreciate it. Then you got your direction you needed.
I did.
Okay, good. Good. That's always good. So then we'll move on to the agenda. 11D was included in the consent agenda. 11E was considered under petitions and communications. The city and county attorney report is next. Ms. Rogers?
No report. Thank you, Mr. Mayor.
The city and county manager's report is next. Ms. Hoffman?
Thank you. We were going to talk about both FRICO issues at the same time, but given that council moved the first FRICO conversation to consent, David Allen is going to give us a very brief overview of what this item is about. It's under my signing authority, with my increased signing authority, but given that it is regarding water and purchasing additional water rights, we thought it important for council to understand what the item is that I'm going to be signing off on, as it does add to our water portfolio, which we all know is critical to our future. So with that, I'm going to have David Allen, Director of Public Works, walk us through this item real quickly. David?
Thank you, Ms. Hoffman. Good evening, Mayor Pro Tem, and City Council members. As Ms. Hoffman indicated, this is just an update for City Council regarding some water right purchases that we're going to proceed with. As outlined in the memo, we were able to negotiate a reduction in the purchase price based on council's approval of the ditch maintenance agreement, which was presented earlier this evening. And the funding for the water right purchases are going to be split between open space funds as well as water right funds. And the reason for that is because a portion of this water rights will be used to maintain a pond amenity in the Dillon Point project. And then the balance of those water rights will be available for use throughout the rest of the city. And it could include other uses, including potential drinking water, as well as a potential water supply for the Town Square project as part of the Civic Center redevelopment. And so the total purchase price here is listed as $144,530. And following the due diligence review from Public Works staff and our legal counsel, we'll go ahead and proceed with executing the documents for the purchase. And so that concludes the update, and we'd be happy to answer any other questions that council may have. Thank you.
Council? Okay, noting none. Thank you, David. Anything else, Ms. Hoffman?
No, sir, that'll do it.
Okay, there is no legislative update this evening and no business before the Broomfield Urban Renewal Authority or the Arista Local Improvement District Board of Directors, and there are no special reports. The final item this evening is council's consideration of a request for future action by Councilmember Law Evans. Councilmember Law Evans.
Thank you, Mr. Mayor. So realizing some weeks ago that it was highly likely that we were going to bring forward and pass the marijuana regulations, which we just did 10 or 15 minutes ago, I wanted to have a public discussion about the fact that we do not have to let the moratorium expire. That's well within our purview at this point. And as I've noted before, I feel very strongly that this needs to go in front of the voters. So the discussion that I'd like to have is different from the discussion that we've had in the past. My discussion, my topic is I'd like to extend the moratorium until such time as we put the question of retail and or medical marijuana sales to the voters, because I feel that this is, I don't feel this process is honoring the constituent feedback that I have received. So that's my request, and I look forward to hearing from my fellow council members. Thank you.
So the purpose of 18A is to see if there's enough council members, which would be 6, to have staff work on this. And so the question is whether we want, whether council, there's 5 other members of the council that want to extend the moratorium and then and put the question on the ballot of marijuana retail stores. Is there other council members that are interested in that? Councilmember Anderson?
Can I make a comment, or is this only to raise my hand that I'm?
No, you can make a comment.
Okay, thank you. I want to, I'm not so sure at this point in time, and I don't think there is support to go back and, do a vote of the, have our voters vote on what some of us had hoped would be a 2-part question, back to just say, do you actually, before asking how do you want to tax it, do you actually want this for sale in Broomfield? And I think sometimes we get mistaken by the 58% who voted to tax the marijuana, that was not a vote that they wanted the sale in Broomfield. And I also, I stated before, and I'll state it again, the marijuana, the THC content in the marijuana, when our voters approved it, was less than 15%. And we're so much higher now. And I understand that this desire to bring this forward, and we don't want to prohibit the products, and because by this share that I thought early on, I had toured a marijuana facility and they provided information when they showed the rosins that, oh, nobody really does that. That's only for like really serious users who have special equipment, and then come to find out that's 30 to 40% of the market. So this is not what, I don't think we really understand what the voters of Broomfield wanted. So I don't think that bringing this question forward is worth it at this time, but I think it really takes that there has to be an alternative such as the task force that Councilmember Tessier was considering. So I think we do have to, we'll bring that forward as Section 18 request and continue to have that discussion. So I guess I'll leave it at that. Thank you.
So let me, I didn't call for public comment. There's nobody in the screen in it because I want to let CRL go home. Like I said, I'm calling for public comment. I'm not noticing anybody in the queue. So I'll go ahead and let CRL go home. Roger, I hope you enjoyed your evening with the Broomfield City Council. So okay, so Councilmember Groom.
Yeah, I think is what I'm hearing you say, just to make sure, is you're
The
saying
Access Live event has ended. Thank you for calling. Goodbye.
Goodbye.
Let's extend the moratorium, although we just passed the I can't even think right now. The regulations. Thank you. And keep the moratorium and continue having conversations in order to give the voters more information about really what we're going to do here in Broomfield. And I do agree with having a little bit more conversation about it and giving the vote to the people. One of the confusing things and some of the feedback that I've gotten is in regards to the revenue. A lot of people heard the revenue over 3 million. And then of course we had the mishap. It went out to the 2.2 million. And then we were at 500,000. Now we're at over slightly over 1 million. And it does, I think, play in people's understanding of whether or not we should sell marijuana in Broomfield. And also for me, there was an understanding that we would also be rolling out a heightened mental health program associated with our regulations. So do we go back to the voters and have them vote on Broomfield regulations with an updated revenue statement that's more detailed, that's more accurate, as well as where the money's going to go, what kind of program that it will go to. So I would support having the discussion. Thank you, Liz.
Mayor Pro Tem.
Thank you, Mayor. May I ask Councilmember Law Evans a question?
Yes.
Thank you. Councilmember Law Evans, since you've been on City Council the last 8 years, how many opportunities have you had to put this on the ballot before passing a moratorium extension?
Mayor Pro Tem, I don't think that that's a relevant question. The question is today, what are we doing with this today? And I have maintained for quite some time now that I do not believe that this process was straightforward, in that we presented to the voters that we were going to have retail. The question we put to the voters last fall was, shall we tax it? I believe that was a disingenuous question, in the sense that the voters did not have detailed knowledge that we were not allowing, and we do not have to allow, retail sales of recreational or medical marijuana. So from my standpoint, this process has been deeply flawed from the very beginning. And I appreciate this discussion very much. I'm far more interested in looking towards the future and how we can best serve our residents than I am in scoring political points, such as you're trying to do right here. Thank you.
Actually, I wasn't, but going back to 2018, when I wanted to put the open space charter amendment on the ballot, I didn't have the support. But our former Mayor Pro Tem informed me that we have this wonderful thing called the Citizens Initiative, where citizens can gather signatures to put anything on the ballot. So if there are enough residents, as you say, that want to vote on this, they absolutely have the right to get it on the ballot by petition. That's what I support. Thank you.
So, Councilmember Law Evans, you and I have discussed this 2 or 3 times, and I respect your sincerity. You know that going back, decades. And but I'm going to tell you, we've been through this 3 or 4 times. I broke a tie vote. You said it was a vote in a study session, so it wasn't. I think we actually had a vote where we had this, and you say this is a behind the scenes project. I don't agree with you. I've taken it a little bit personal, but that's okay. I still, we're still friends. But my whole point, I mean, I like I said, we just went through a huge process that started out with how we put it on the ballot. We've now gone through regulations, and going back and revisiting the ballot is something that normally I don't talk at this point, but I'm going to. I don't get it. I think it's trying to relitigate something that's been decided tonight. So I'm not hearing enough people to support doing the moratorium. I mean, you brought it up again, and I understand your position, but I don't think the direction to the staff is to bring this back. But I felt I had to comment. So
I appreciate the sincerity of your comments as well, Mr. Mayor.
okay, thank you. So we'll go ahead and move on. We'll adjourn. We have an executive session that was approved. And we have a separate Zoom number that we've got to go to. The city manager said, based on the fact that she's had several meetings with staff, that she thinks that she's looking for direction tonight, and the attorney is. So it shouldn't take very long. We're starting it before 10:30. So let's go ahead. The connection was sent to us earlier today. I'm trying to find it. Yeah, I found it. So let's. How many minutes will it take, Jennifer, to set up? 2 minutes. So we will reconvene in 2 minutes. So if people need to take